सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः। ॐ नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय।
So welcome you all. Good morning, good afternoon, good evening, good night to somebody in the worldwide. We are connected to the globally. We are delighted to have a distinguished guest and experts in the field of Ayurveda and integrative health. We welcome experts. Dr. Pratap Chauhan is an eminent speaker, educator, philosopher, so many titles he has. And we have Dr. Samina Ahmad, an integrative physician. Dr. Sommes Kaushik is classically trained Ayurvedic doctor and naturopathic doctor. And Dr. Asavari Manvikar, who is a MD in Ayurveda. And we have Dr. Aslesha Raut, integrative Ayurvedic practitioner, Ayurveda, classically trained Ayurvedic doctor from Illinois. And myself, Dr. Shekhar Annambotla. These are the panel of experts. We are going to discuss about the scope of practice of Ayurveda for the various levels. We have lined up all the various levels of training program as stipulated from as per the guidelines of the World Health Organization, a benchmark training. Along with that, Ayush, Ministry of Ayush, Government of India, we have laid down. And along with that, what we did it, we have modified some of the curricula according to the individual country and state levels legalities. Hence, these are not all directly a true copy of the World Health Organization guidelines as also Ayush guidelines. It can be modified according to the provision is given for the according to the country, according to the state, where you can modify some of the principles. So now, with due respect, this will be recorded presentation and this will be available for the people who are missing these lectures, and they can join, and after that they can also participate and learn this information on the website. We post on the website, AAPNA.org website. Now, I would like to invite our distinguished guest speaker from India, Dr. Pratap Chauhan. Is a BIMS, is an Ayurvedic physician, author, public speaker, TV personality, and a pioneer of Ayurvedic telemedicine. The first telemedicine started by Dr. Pratap Chauhan and Jiva Group in the world in Ayurveda. He started the world's first Ayurvedic website, jiva.com, in the year 1995, and he is the only Ayurvedic doctor to have won the prestigious World Summit Award given by the United Nations organization. He is the founder and director of the Jiva Ayurveda, a company that runs a network of 80 clinics all over India and world's largest Ayurvedic telemedicine center. Sir, you need to put a cloth, sir. Oh my God. And consulting about 8,000 patients daily 8,000 patients per day. Dr. Chauhan has traveled more than 40 countries spreading the knowledge of Ayurveda to common people. He has established Jiva Ayurveda School in Japan, France, Poland, and Lithuania, and is a lifetime Ashoka Fellow. He has published first ever big data analysis on Ayurveda. He is well respected and renowned, humble, very simple personality, no ego, and very simple, you can see, and his wisdom. And he is going to discuss today, and of course it's the late night for India time, it's 11:30, but we are giving the first time for him. And also it's very important for us to give about the importance of the World Health Organization guidelines and Ministry of Ayush, Government of India. We are continuously communicating with the Government of India Ayush Ministry. Ayush Ministry does not have direct influence on the Ayurveda control in various countries because this is established in India, Indian jurisdiction, but they can give a wonderful guidelines for us. We as an Ayurvedic doctors here in America and are trained by the Ayush and Government of India, and they're spreading the knowledge of Ayurveda. The database of the information is available on the website called AAPNA.org, Association of Ayurvedic Professionals of North America, established in 2002, 19 years, tirelessly working, and more than 78,000 members around the globe of 134 countries. Is the largest, biggest organization, global organization. We are proud to be associated with that, and Dr. Pratap Chauhan is one of the advisory board member. Constantly he is giving wonderful advices all the time, and anytime he is always available to us to give such a wonderful guidance for us and advices for us. And what he says that, Shekhar bhai, don't worry, do it. Go ahead, do it. That is his way of talking. So now welcome Dr. Pratap Chauhan to join with us and to give the audience wonderful message to us. A scope of practice of Ayurveda on the basis of the guidelines of the Ayush and as well as World Health Organization.
Thank you, Dr. Shekhar, and namaste to all the participants and all the great personalities which are participating in this webinar. Although it's quite un-Ayurvedic for me, it's almost midnight in India. But you know, Dr. Shekhar, he is doing some amazing work to unite the Ayurveda professionals all over the world. And we often talk and we often exchange ideas. And I'm always, you know, inspired by him. Tirelessly, he's working all the time. And in addition to his own private practice, he does so much, you know, it's always amazing to get some inspiration, some energy, positive energy from him. So again, you know, he does wonderful conferences on various topics, amazing, you know, topics, you know, in some of them I also participated. But today this is also a wonderful topic that he has picked up, scope of Ayurveda practice, you know, where various levels of training. This is important today because, you know, today Ayurveda has become a hot word, not only just in India, but all over the world. Of course, my association with Ayurveda is now over 30 years. And I remember the first time when I started traveling outside of India, that was almost like 26 years ago. And ever since, the interest is growing more and more, and especially during this last 1 year of the pandemic, coronavirus pandemic, interest has grown more. Even now, the medical professionals, not only just normal people are interested, but a lot of medical institutes, many universities. In fact, the Ayush ministry is also doing a lot of collaborations and memorandum of understandings with various universities. So, but what I want to just, briefly mention, I'll just focus on the subject which was given to me. The subject is that importance of Ayurveda training based on WHO and Ayush benchmarks, which are already there. But I would like to just mention why it is necessary, why it is necessary in this time to focus on standards and benchmarks, because we want to establish Ayurveda as a medical system, and not only just a curative system, but also a preventative system, which is, of course, we all know that the main goal of Ayurveda, swasthasya swasthya rakshanam aturasya vikar parashmanam. So which means that the two parts, preventive part as well as the curative part. So, but we have to be very careful, and that's why the need of this topic, because we have to learn what has happened with yoga. The yoga came, of course, from India to all over the world. But look what has happened with yoga. It has been diluted. Now there is, so many hundreds and hundreds of types of yoga is available. Interestingly, I was watching just a video other day. Somebody forwarded me a type of yoga called beer yoga, and which is now even popular in India. Forget about the West. It's also come to India now. So we have to be very, very careful. And as I said, associations like AAPNA and other Ayurvedic associations of the Ayurvedic professionals, they have to take this lead. And it is our responsibility to make sure that Ayurveda doesn't get diluted into so-called herbal. The word herbal in India, it's amazing to see like how in last 1 year, almost a few hundred new companies have come in this area. And everybody is claiming they're like Ayurvedic, every product they're bringing out, even herbal or Ayurvedic, lot of, nutraceutical products, phytoceutical products, phytochemicals, immunity boosting, it's become flooded with, the market is flooded with immunity boosting, and everybody puts the word Ayurveda there. So this is something, which can create a lot of confusion, and of course can create a dilution for the mainstream medical system that we're all trained in and all we're practicing. So then anybody will come up with some kind of a kit, these kits are very popular. Okay, this is a kit for your diabetes, this is a kit for your joint pain. So that's why, it's very important we lay down some kind of standards, benchmarks. And I was looking at some of the courses, and Dr. Shekhar discussed with me a few days ago also how he has put together some very, very interesting, names of the courses. And I would say that all these courses that are going on now all over the world, they should follow some kind of protocol, some kind of, benchmarks and standards. Otherwise, anybody will, just learn something and they will call themselves as Ayurvedic, professional or Ayurvedic, practitioner. So that has to be very, seriously, we have to all work together to implement that. And we have to learn from yoga, and not only yoga, there's many other things which have been, used and then they're lost in this so-called the fad or the fashion or the popularity which comes for a little while and then it goes away. So we have to also, especially like when it comes to the treatment part, the panchakarma treatment, or even just if it is some abhyanga. So it's not just some kind of a oil massage, which people can go in a spa and, get a spa massage or spa therapy, or what we call it like a spanchakarma, spanchakarma with a spa. So that has become very, very popular in all these things. So we should be, again, whether it is a panchakarma therapist, or it is some kind of a Ayurvedic nutrition course, or it is some kind of other, maybe Ayurvedic practitioner, or even in future with progressive level, if somebody becomes an Ayurvedic, practitioner or equal to BMS, all these benchmarks have been put together already. And if you want, you can, definitely have a look at them. That should be our main, goal, especially today we are talking about this. So I think something should come out of this, or the takeaways should be that we should not forget that Ayurveda is not just something like a very simple thing. It's a very, very serious personalized medical system. Even if somebody has to take something for immunity boosting, or even if something has to take something for prevention, in Ayurveda we still consider the prakriti of the person, the age of the person, so many factors are considered. So today, because there are so many words which are becoming very popular all over the world. Words like, integrative medicine or integrated medicine. Now what actually is integrative medicine? If you read the definition or something on the Google, you will find that integrative medicine is a healing oriented medicine that takes into account the whole person. That's what they say, including all aspects of life. It emphasizes on the therapeutic relation between the practitioner and the patient. And this is actually Ayurveda. If you go a little bit deeper and try to understand, and you will see that this is what Ayurveda is also talking about. But when we hear this word integrative or integrated, which is very popular now in many advanced countries, I am also part of some of the groups where they're talking about it. They don't know much about Ayurveda. They have heard maybe some Indian system or yoga or something like that. But really speaking, Ayurveda is a very, very prominent part of this integrative medicine. If it is going to be the future of medicine, as they say, Ayurveda should play a very important role in this. And this will be our duty, all the practitioners. We are all, wherever we are, anywhere in any part of the world, we have to prepare ourselves. We have to present ourselves in a way that we can explain, we can actually represent our knowledge in a more, expressive way. Sometimes we just stick to something like we are 5,000 years old. People think we are some kind of a religion or some kind of, Vedic knowledge, which is ancient knowledge. But really speaking, it's a wonderful knowledge. We need to really, again, make some standards and, put it in a language that is more modern language, which people can understand. Take the word P4 medicine, another very popular word now. When I visited an institute in France where they're working with P4 medicine. These people, they come up with some nice word. But if you will see what is P4, P4 stands for 4 Ps, which is predictive, preventive, personalized, and participatory medicine. So again, what is this? This is Ayurveda. Predictive. Ayurveda is predictive, based on your prakriti, based on your agni, based on your various things. It's of course preventive. One of the main part of Ayurveda is to prevent disease. It's personalized and it's participatory. The Vaidya and the physician and the doctor, they have to both work together. So actually, again, this is Ayurveda. But these people, when I visited there, they have no idea what is Ayurveda. They don't know. They're just creating their own system, which is exactly what Ayurveda talks about. Functional medicine is another, it's a model of individualized or patient-centered. They use this word, individualized or patient-centered or science-based approach, that empowers the patients and the practitioners to work together. Again, it's something very similar we hear, this is like Ayurveda. Systems medicine, another word, based on, then there is a medicine based on genetics. There is endless list you can find. Already, what I'm saying, already it is happening. This is our duty wherever you are in any part of the world. And if you are an Ayurvedic practitioner, if you are an Ayurveda enthusiast, or if you are an Ayurveda lover, we have to work together. We have to, it's not about just making benchmarks and standards and just put them in a book somewhere. These have to be, explained to the people. These have to be implemented. These have to be put into practice. And not only this, there is so much of this other things. You might have heard the word mindfulness. Mindfulness is a popular word all over the world. Psychotherapy is happening all over the world. Meditation, energy healing, chakra healing, prana healing, theta healing, reiki healing. So many therapies. Do you know what are these therapies? This is just Sattvavajaya and the Vipassana Chikitsa of Ayurveda. Unfortunately, we have really not done much in this area also. This is a part of Ayurveda. In fact, it is our responsibility as practitioners of Ayurveda. We should be also, become learning, first of all, learn this and become expert in this, make also, proper benchmarks, and everything has to be put together in a very scientific way. So what I'm trying to say briefly here is, I don't, want to go in much details. We need to establish Ayurveda programs, courses based on benchmarks. And as I said, benchmarks are already there. WHO or Ayush, they're there. We can have a look at them. But, just that course outline is not enough. This is not enough. We have to then learn how to, create a program, how to create courses that include practical, which is not a very strong part of our Ayurveda courses today. If we look at our education, especially in India, we all know that. So we need to introduce all this in a very, very practical oriented way. And of course, along with that, we need to also introduce soft skills. Why some of the people in the world today, in India, why they are very, successful practitioners of even any pathy, Ayurveda or allopathy, because soft skills play a very important role. Communication plays a very important role. How is your behavior? That's a very important role. And especially when it comes to Ayurveda. In Ayurveda, the acharanam, what is your lifestyle, what is your behavior? Not only that, love, compassion. If you read the qualities of the Vaidya in Charak Samhita, I always like to quote this one. There are other three also, but Suchi is described as one of the qualities of Vaidya, which is, it's not just physically you have to be clean. It means you have to be mentally clean, clarity of mind, purity of mind, very, very important. You have to be spiritually rooted. This is very important for a Vaidya, because this will definitely, make you grounded, rooted into deep values of Ayurveda. And in addition, not to forget that today we are living in a technological world. When I started practicing, early 90s, the first time when I went outside of India, I was fascinated by the interest people showed so immediately on my return to India, I thought I want to share this knowledge with the world. So I made the world's first Ayurvedic website. Nobody could even think. 1995, internet was not even around. It was available through a very difficult process. But I created and I did a lot of technological intervention, especially in Jiva. Today we have around maybe 300 doctors, Ayurvedic doctors who work. And we have created wonderful protocols, technological based protocols, which are based on decision-making algorithms, which also are artificial intelligence, empowered machine learning is used. So we should be expert in technology. What's the harm? And at the same time, we should be very well, trained in so-called modern medical terminology, because patients come with a lot of investigations and they come with, terms which are maybe not written in Ayurvedic books. We have to understand. We have to then use a protocol, which we are using in Jiva. Our doctors, they use protocols. And not only that, we have created a learning management system, LMS, for our doctors to go to that level. We have actually given them some grades like Shushruta and Kashyapa and Jivaka and then Charaka. There's various levels they can learn and take an exam, and then they can go to the next level. So we have trained thousands of doctors in India. We do continuous CMEs, which we call the continued medical education programs. So my conclusion is that you're all wonderful people out there. You're in different countries. You're practicing, working for Ayurveda. Let's be united together. Let's work together. Dr. Shekhar has already created a platform, a wonderful platform where people can come together, and we should definitely, be very, very, modern in our thinking. We should think out of the box, and at the same time, we should be very, very well deep rooted into our Ayurvedic principles, Ayurvedic values, and this is what will bring Ayurveda really to the forefront. So with that, I would like to thank once again Dr. Shekhar for having me on this platform. Although it was a little late, but when he called me last week that I want you to come and share something, I was very, very happy that I will come. Doesn't matter. One day I can sleep a little late. Doesn't matter. For the sake of Ayurveda, we can always sacrifice our basic rules sometimes. Of course, not to do any pragya parad, but certain things can be. So thank you very much. And I can only say that, whatever we are doing in Jiva, we will be very happy to collaborate with you and take this mission forward to create wonderful standardized programs where people can come, learn, and if needed, our facilities in India can be utilized for practical trainings for all those people who are outside of India and they want to really, because we have a huge footfall of patients, daily patients, and so it's always good to have a lot of patients to see what's going on. And we have a database of 2 million patients now, which is available also to analyze. In fact, my future plan, it will take some more years, is to create all these protocols and database related protocols, and then maybe open it up to the Ayurvedic practitioners, so everybody can just log in and see what's going on and what's the database is saying. So that's my future plan. Of course, I have to standardize it, make it that it's workable for all of us. It will take some time, but that's my dream. Thank you very much. And Sekharji, namaste. Thank you for having me here, and I will be always with you. Whatever mission you have taken, I'll be happy to collaborate with you. Thank you.
Thank you, Dr. Chauhan, and such a wonderful, delightful information pass on to all the audience and speakers, guest speakers, and doctors, integrative health professionals, and medical doctors, Ayurvedic doctors, as well as students from the various parts of the world. And I personally met Dr. Chauhanji at in Jiva Institute, and it's a very delightful center, and a lot of things are there. And I was encouraging him to start a Jiva University in India, where we can establish a lot of educational programs and training programs and collaboration, a lot of databases there. This is exactly what we are looking for, that more and more clinical practice is required. Theory, we can talk, we can read. Amazon can give a lot of information. Google can give a lot of information. Everything is available. Even if you put in sattva word, you can type it in the Google, you will get all the information. But how to behave sattvically, that we don't know. We can read everything, but we don't know how to behave sattvically. That is the thing. A practicum part is important. Hands-on training important. Clinical internship is important. Rotationary clinical internship. That is the reason medical schools also always they focus on the not degree based like that. They have a stringent clinical rotation is very, very important. In Sushruta, I clearly mentioned drashta karma. Drashta karma means that one has to be seen like that. Only not on the paper or the paper certificate or like that. But anyhow, he has given us such a wonderful information. Clinical internship is very, very important. That is the reason we are focusing on that. Our Association of Ayurveda Professionals of North America is goal is that we are creating a luminaries of Ayurveda experts. So in that, what they can do, we identify the senior most Ayurvedic doctors, Ayurvedic practitioners, integrative doctors. We list them, and students can go and do apprenticeship with them, and they can learn the various levels of techniques and expertise of knowledge. That is our goal, is that eventually we will develop. Now, with due respect, I would like to invite next speaker, distinguished doctor, who is Dr. Sommes Kaushik. Sommes Kaushik is a classically trained BAMS doctor and studied naturopathy degree, 4-year medical school completely. And also he has done public health, MPS Masters in Public Health, and also Masters in Public Administration. So, and also an experienced yoga teacher, 500 hours of training. And also he is a professional Ayurvedic continuing education provider for the AAPNA and also AAPNA board of director. And Dr. Sommes Kaushik is Ayurvedic specialist, consultant and institute after completing a BAMS 6.5 years of Ayurvedic training in 1983 from Kurukshetra University, India. He worked as an Ayurvedic medical officer before moving to US. He earned MPH, MPA from the University of Alabama, Birmingham, and ND from the University of Naturopathy degree from the University of Bridgeport in Connecticut, where he taught Ayurvedic medicine and public health courses, worked in the director of admissions for the College of Naturopathic Medicine. Before moving to Connecticut, he worked as an epidemiologist and director of HIV and AIDS Zero surveillance with the Alabama Department of Health, Public Health, while maintaining an Ayurvedic practice. He has been faculty member of the University of Bridgeport, Division of the Health Sciences since 2001. He has over 26 years of experience. Now he is almost 30 years of experience as an Ayurvedic physician. He offers seminars, lectures, Ayurvedic medicine. He also teaches, he has developed an institute called Teaching Institution Ayurvedic Training Programs. Also, he has his own platform of the clinics running in the New York, 2 clinics he is running, in Connecticut, 1 running, whole family of naturopathy doctors. His daughters are also naturopathy doctors, his wife is a naturopathy doctor, whole family of naturopathy doctors, licensed physicians. So they're holistic, completely holistically practicing. And also Dr. joined as an Ayurveda Institute and Naturopathic Therapies in Fairfield, Connecticut in 2006. Dr. Kaushik offers various courses, workshops, and Naturopathic College of National College of Naturopathic Medicine in Portland, Oregon, and various national, international symposiums and events. He also holds medical camps in India. He has a lot of charitable services he perform and do the lot of medical camps, free medical supplies of the medicines. And underserved population would like to expand the service to other countries also. He would like to expand in other countries where the people need medical services are required. Now 4 gems are there in their house, 2 daughters and wife, and he himself and the whole family is dedicated for the health profession. We are very honored to have him. He is one of the board of director and professional continuing education provider, and he always gives, whenever I call him, he picks the phone. Even though how much busy he is there in the middle of the patient, Dr. Shekhar, I will call you within 5 minutes. Then once he finished this thing, and he will pick up the phone and talk to me. That is the thing, is dedicated like that. A lot of people think about that I am the one doing all the AAPNA organization like that, but somebody has to steer it, somebody has to work it, and we definitely work on that. Everybody is a busy practitioner, but we communicate with them, whatever the necessary things, whatever the necessary documents we needed, they look into that, they review it, and they proceed to us, and they communicate with us. Thank you very much, Dr. Kaushik. Please join with us, and he will be discussing today why we need to have various levels of training. Like if you see in the modern medicine and other pathies like that, like physical therapist is there, osteopathic therapist is there, occupational therapist is there, barber is there, cosmetologist is there. Everybody is different. And naturopathy physician is there, acupuncturist is there. We have a different distinctions are there. So can we call a person who completed his 120 hours of training in Ayurveda, can we call him as a doctor? Then a medical doctor will ask, what type of background you have? So that's a question recently, one of the students telling that, let me tell you, the spleen, how many spleens are there in the body? Madam, definitely one. I'm not sure that it's the right side or left side. That is the situation, is that a situation that they have an anatomy, physiology, pathology, and everything they needed to know, which is missing that part. Now we need to have standardization of education. Now various levels of training is important. Dr. Kaushik will discuss about the various levels of training, which is stipulated and explained in our website, and he will talk about that. Thank you, Dr. Kaushik.
Thank you. Thank you, Dr. Shekhar. And again, thank you for inviting me to this platform. So I am, like all of you, graduate from India, came here a long time ago. So this is now 37th year of practice. The place you read from is old, and we're still learning. Doesn't matter how long we have been practicing Ayurveda. Ayurveda is so old and so ancient. We always will be student of Ayurveda, and every day with each patient, we'll learn something new, and then we make that part of our practice for the next patient. So learning will never stop. Of course, again, I just heard Dr. Chauhan with all his experience and expertise. We are trying to follow the curriculum which we learned in India, which was now the Ayush curriculum or coming from WHO, and that should be the base. When it comes to US, we have found that Ayurveda have been broken down into small pieces, and eventually we're diluting it more and more and more. And that does create a problem. Reason being, there are no rules and no laws which can manage and tell you how much you can perform and how much you can do. So basically, the scope of practice has not been established, and the scope of practice has not been basically put together somewhere, and there is no agency to monitor that. I do see many individuals who have attended a weekend seminar, or maybe go to a nutritional institute or some other profession, and they have attended a weekend seminar or 4 days or 3 days, and then they had this piece of paper, so and so has successfully attended a weekend 100 hours or 20 hours, 30 hours of Ayurveda, and they become Ayurveda expert. And in fact, many yoga institutes in the Northeast all have their own Ayurveda expert, and sometimes it becomes so difficult to discuss with the patient who comes unsatisfied, saying that I have seen 4 or 5 Ayurvedic experts and Ayurvedic medicine doesn't work. And then I ask them the name of the person, what kind of training they have, and I find these people have no training. So when it comes to Ayurveda, I will still agree with Dr. Chauhan that it has to be a Ayush base or whatever we have found from our own trainings from India. It has to be a doctorate program, and less than that should not be allowed to practice and see patient and diagnose patient and work with them. But in some cases, we do need to have individuals, like in case of other profession, we have nurses, we have nurse practitioners, we have pharmacists. So in that case, some category can be used, but not diluting it to a level where we have individuals who have only 200 or 300 hours of course, and then they are allowed to see patients. So that is something need to be really established. Nama was the first one, and then Dr. Shekhar was part of it, and then AAPNA found 3 categories. First was the Ayurvedic health counselor, or some called Ayurvedic health and wellness counselor or wellness counselor, but basically these are the health counselor which have roughly about 1,000 hours of training. Definitely they do have some understanding, and there was also, with that influx of many schools, anybody who took some training opened their own school, and that need to be also monitored. In many of these schools, like Dr. Shekhar was just mentioning about the spleen, that does happen actually, because many of those schools do not have any requirement or prerequisite for anatomy and physiology. And when there's no anatomy and physiology requirement, you don't even know where your heart is, where your lungs are, and how many of those, if they are in the thorax or in the abdomen or somewhere else. So basically, you have no idea what you're dealing with. So some knowledge of anatomy and physiology has to be there. And with that, a basic knowledge is required for the herbs and the spices, and the counselor and need to be told in advance to very clearly, your goal is to counsel only, and also you're limited to only treating and suggesting diet for the patient, not more than that. You are not there to diagnose and take patients. And I have seen patients who have been to Ayurvedic experts, but I find these are counselors who have taken a training and they will take in cancer patients. Reason being, many of the patients are tired of seeing basically oncologists, and they are tired of taking drugs. And sometimes the side effect of drugs actually destroy their health faster than the disease itself. So when you look at these patients, they are critical, they are sick, they are desperate, and in that case, they will look for some other system medicine. And Ayurvedic medicine actually is very popular nowadays. So they will look for Ayurvedic expert, and many individuals who have a very minimal training, but a good background in IT, or they know how to market themselves, and very soon they will become the world-renowned experts in Ayurveda. And one time I got a call from a yoga studio asking me to join them because a world-renowned expert is coming to their studio. And I read the name, and I asked the expert if he would like to see me there. What I found, this expert was my patient just 9 months ago. And he lost his job. And after that, I'm not sure what he read, but very soon he was connecting with all these studios and advertising as the world-renowned expert of Ayurveda. And that was really, really painful to see. How come? So, of course, this person told me he will come and see me. And I said, what are you doing? It's all about marketing, because he knew some people, he read some books. And what Ayurveda is, he talked to some individuals, he gave me some names. And they told that if you know a few herbs, and teach people and tell people that if you have any digestive issues or any disease at all, as long as you know and how to make khichdi, 50% of disease will be gone. And that is not medicine. You can suggest to individual, but again, it has to be completely personalized. And that is why we look at the Chatushpad of the treatment plan. We look at the Chikitsak, which is basically the Vaidya or the Ayurvedic physician. We're looking at the attendant, we're looking at the Aushadhi, and we're looking at the Rogi. So Aushadhi is important, but Rogi also comes here, who becomes has to go through so much pain because the scope of practice has not been made very clear with our students. So we see the first level we are seeing mostly is the Ayurvedic counselor, which is established already. And Dr. Sheikh have done a wonderful job in putting those categories together. A lot of work went into this practice and into this putting all these categories together. But again, we need to make sure that all the associations, NAMA, AAPNA, and again, there's one more came recently. I think California College of Ayurveda have put something together. So they're also working on. So there's so many associations. All of these individuals need to come together and work for Ayurveda, not for individuals. And for that, the education system, the categories has to be well established. Second category, what I'm finding is Ayurvedic practitioner. These individuals have much better training. So instead of 1,000 hours, they have roughly 2,000 to 2,500, depending on the school. And again, depending on the school, the level of training, the knowledge and depth also differs. When you find these schools, it must be a requirement that a BMS or MD in Ayurveda should be in charge, or should be in charge of curriculum. Not somebody who have a counselor degree and then they start a program where they start with the counselor program and then they are offering the practitioner program when they themselves do not have that knowledge. And one more thing I'd like to make clear, reading few books or spending some time with the guru or Baba does not make you an Ayurvedic doctor. Or I went to India 5 times. That doesn't make you an Ayurvedic doctor either, because that is what people tell. I go to India every year, and what difference does it make? Millions of people go to India every year. As soon as you land in New Delhi or Bombay or anywhere else, that does not qualify you become an Ayurvedic doctor. And I've seen that many people go, and I go to Rishikesh, I go to Gurukulam. Fine, that's your own journey, but that is not. So basically, we have to be very strict about what Ayurvedic medicine is. We have to be very strict about what are your options and what you will be able to do. In the beginning, many schools will tell them, as soon as you get the training, you will be able to do all this. No, not true. You have a very specific requirements, and we must have a disciplinary board putting all these people together, telling that if you were found practicing outside of your scope, then basically your privilege to practice Ayurveda will be dismissed, cancelled, and again, that had to be done. Otherwise, anybody who have taken any just little training becomes an expert, and they call themselves Ayurvedic practitioner, Ayurvedic doctor, Ayurvedic physician, and that should not be acceptable. Then comes the third training, especially Ayurvedic doctor. And these are what we thought will be equal to BAMS, which is and their equivalent curriculum. Problem is, we have difficulty finding places where the actual training, the physical training, the preceptorship, and patient contact will be available. The reason is that many of the schools where they have internship sites for MD or naturopathic doctors or chiropractic doctors, they will not take our students. And in our own clinics, we have limited place. We have an institute. We started that a few years ago, Institute for the Advancement of Ayurvedic Sciences. And the reason we did that, just not to produce again the counselor or practitioner, it was only for a doctorate program. And the students should have the commitment they will continue for 5 years. And then that's where our 3 clinics came handy. So we can actually ask them or allow them to work there. So after the second year, they're allowed to come and help in our clinic, work with the patient. And again, we make it very clear with the patient that this is a person under training, second year student or third year student, and they're learning Ayurveda. And majority of people have no objection if we make it very clear in the beginning, because the HIPAA, the privacy of the patient comes first. And if the patient is not comfortable, when we tell them, the person, you just go and wait for the next patient, or go downstairs, or you can go to the therapy room, help them there. So until the patient is, so the training has to be really, really good. And that's also our camps came handy. We started medical camps in India in 2008. At that point, there was no plan or idea that we will start a school. But eventually in 2018, when we started the school, this came handy. Now, not only we are able to help the individuals who come for help, but also our students are having hand-on experience learning. At least they will learn checking the pulse, looking at the tongue, examining the physical exam, all these things. Otherwise, that is not possible. Again, in many places, if we are not licensed or some kind of license in this country, we are not allowed to do any physical exam. So maybe with the permission, we can, with a disclaimer, we can check the pulse, look at the tongue, but no physical exam is allowed. And that is also, we need to keep in mind, if we are training the future physicians or practitioner, we must have someone in staff who is licensed, so that under them, we can train the individuals and allow them to at least have some physical exam. So we'll know, our patient or the students will know what they are looking for, where they are looking for, how they will look for, what they are trying to find. So basically, that should be the keep in mind. So the training itself is of importance here. When we are looking for a doctor, when we are training an individual, a future practitioner, we also keep in mind, this should be the person to whom I will feel comfortable going as a patient. Later on, you never know. You train the individual, we should be confident that what the product I'm giving to the world is somebody worth, that I will feel proud of going as a patient one day. If I don't feel comfortable, it means you have not done a great job. So in that case, the training itself is of very importance, and we're looking at the It doesn't matter if it's a counselor or practitioner or the doctorate program, but the doctorate program itself is basically established about 4,500 hours, and which is a equivalent to what we usually get in India, BMS. But again, it should also be a program where we make sure that the hand-on experience is given to the individual. These basically are the three specialty we are seeing, or three categories we are seeing. And again, there are many special programs which are created, and Dr. Shekhar have done a great job. And those will be actually, somebody else is discussing those. But the main thing I'd like to keep mentioned here, many of those do not have enough hours as given to those programs. And the person who is taking, he did a great job mentioning many places, the person should have a massage therapy license. It means they have the permission to work with the patient, touch, and some knowledge of anatomy and physiology, which has to be there. But again, when you're looking for someone who is going to be practicing and seeing patients on the daily basis, again, if you're looking at the 10 leading causes of death, cancer is now competing with the heart disease. Heart disease is still the number one. Again, the data is about 4 or 5 years old, but Centers for Disease Control and Prevention provides that after about 4 or 5 years. Looks like by the next data comes out, cancer will be the number one. So there's so many patients who need help. And even though modern medicine have great technology, they have done a great work when it comes to curing the disease, none of the chronic disease is curable in their plan. They are only treatment plan, and we are only providing some treatment and some basically pacifying the symptom. Individuals are looking for a system which will relieve them for the pain and also provide something to cure and reverse the condition. Ayurvedic medicine does have that capability. We have seen great results with that. But again, it has to be our system of educating them, which provides great trained and well-focused individuals who not only have a good background, also have the spiritual knowledge and information and the base, and they're willing to put the patient and the client first, not themselves. So with that, I think I will stop here because we were told the limit of 15 minutes. And thank you very much. And again, any question, I'll still be around.
Thank you, Dr. Sommes Kaushik, for giving various levels of influence and practice and clinical practice. Being you are a expert in the as well as a teacher, as well as a clinician, as an administrator, so many hats you have, and you have wonderful knowledge of the holding of the administrative level as well as the curriculum maintenance like that, and at the same time licensing parts, and so many areas you worked on at board levels like the board of advisory board like that. So it is definitely an outlook for us. Look into that, how Ayurveda is becoming as a khichdi. We need to re-identify the situation, like who is what. First of all, licensing is the last part. Licensing is not, we are not working. I always call that licensing is a can of worms. If you own the worms, if you open the can, there's a lot of worms are there inside that will come and bite you. Same thing.
Naturopathic medicine have been trying to get that for a long period of time, almost 60 years. And roughly half of the country is licensed, but it's a journey. We'll get there.
Exactly. It is a journey of the way how the naturopathy degree is done like that. There is no way of a naturopathy assistant, naturopathic practitioner, naturopathy health counselor, not like the different degrees are not given. Naturopathy doctor, that means a person who is even Dr. Kaushik has completed his naturopathy BAMS degree. He has to again go through the 4 years of complete program of naturopathy degree. So similar way, a lot of medical doctors who has completed the training programs in India, and then they came here, they have done residencies programs and everything like that. So similar way, our goal is that to start some level of a full training program. A lot of students here in America, they are not felt like that, they don't have an adequate knowledge, adequate competency of the training program. Those things are there. So that is the reason we are going to work on that and giving the scope. This is the platform we are created today a scope of practice for various levels of training program, what they can do. That is exactly what we are going to do, and we are going to discuss and everything. Your feedbacks are very, very important. We have already 216 members joined in this webinar, and it's a big group of people, and these people can give the feedback to us. We will send you a feedback form to you, and that way you can send your feedbacks, and we will incorporate a constructive feedbacks in our website and everything. We can work on that. Now, next we will talk about integrative health. As a medical doctor, medical trained doctor, and from Pakistan, Dr. Samina Ahmed, who is a well-known integrative physician and practicing allopathic medicine in Pakistan. And then she has a calling, inner calling is that she wanted to go through the process of the integrating Ayurveda. She never thought about that she is going to become an Ayurvedic doctor. She wanted to be an integrative doctor, integrating of the various systems of medicine. And Dr. Integrative physician, she is also Chopra certified consultant and Ayurvedic practitioner. She is certified massage therapist in New Jersey and certified body worker in New York. And Dr. Samina is a scientific advisory board of the Lifespan, Lifeform, a nutritional supplement company based in California. She hosts global webinars guiding her clients on principles of health and wellness using the Eastern Western modalities. She has written health columns for magazines and produced and hosted many popular TV programs on healthcare in Pakistan, along with hosting a first cooking show for 7 years. She runs Dr. Samina's Wellness Center in New York, specializing in Ayurveda and holistic health sciences. Dr. Samina also manages the biggest South Asian band, which is called Janoon, and she's also founder and co-executive director of SSGWI, Salman and Samina Global Wellness Initiative 501c3, a non-profit registered organization in New York, which works using the art and culture to promote interfaith dialogue and health and education initiatives in Pakistan and other neighboring countries. So she is a well-known figure, and we would like to invite Dr. Samina to join with us and discuss how a medical trained doctor, and like we have some of the doctors are here, who is anesthetists are there here, and cardiologists are here, and pediatricians are here. A lot of doctors are there. And those doctors, what type of, whether they wanted to go to the learn Sanskrit and the learning of all these things, they don't have time to learn. They wanted to have a specialization in particular area to learn. And at the same time, what is the purpose of these things? Learning, they can, any cases they are there, any advanced cases of practice is required, then they can refer the patients to the right persons, the right people who are qualified, well trained in Ayurveda. That way, they are not ignorant of the systems of medicines, like what they are practicing of allopathic system of medicine. They should know also acupuncture, Ayurveda, naturopathy, and chiropractic, where they can refer the patients to them. Being an integrative physician, and she is going to talk about that. We have created a separate category of integrative Ayurvedic doctors category, where they have existing license they are having. And along with the license, they are practicing Ayurveda as one of the modality in their practice. Welcome, Dr. Samina.
Thank you so much. Good evening, good morning, good night, and namaste, assalamu alaikum. Hello to everybody on this wonderful platform. And my heart goes out to all the wonderful doctors and Ayurvedic specialists, especially Dr. Shekhar, who makes it possible for all of us to get together as a community, which I think is the objective of Ayurveda, to literally integrate all of us, because we are one humanity. We might come from different religions, different faiths, but at the end of the day, we are all one. So I appreciate this time to actually share with you some of my thoughts, and also to describe the two different scopes of practice for an integrative Ayurveda doctor and an integrative Ayurveda researcher. So before I move into explaining the two, I would like to mention something about integrative medicine. So I am an integrative medicine practitioner, and to give you a background, I trained in conventional medicine. And it doesn't matter which particular specialty or kind of work I trained in, but whenever a conventional medicine trained person decides to also delve into alternative medicine or modalities which specialize, in whether it's Ayurveda or Chinese traditional or Unani, and they put it all under one umbrella, they are called integrative medicine practitioners. So I was very fortunate to have trained with Dr. Deepak and also with Dr. Andrew Weil. And Dr. Andrew Weil is also called the father of integrative medicine. And according to him, the definition of integrative medicine is that you are going to have an intelligent combination of conventional medicine and alternative medicine. But what we are doing here is we are trying to move from the disease-oriented, symptom-oriented medicine to health and healing. That is the most important thing. And that is the need of the day. And Ayurveda provides that particular piece. And we are also interested in going into those practices which are evidence-based, sustainable. And here the focus is on the fact that you and I are not just a body, we are mind, body, and spirit. And we practice lifestyle medicine. We do have a lot of focus on patient-practitioner relationship. And we get all that concepts we have learned from, of course, ancient modalities as well as from just ethical, mindset. When you and I do not consider the patient to be just a human body, and we are literally, our mindset is that we are saying that you and I are spiritual beings having a human experience, not human beings having a spiritual experience. So when you and I consider ourselves as spiritual bodies, then we have more empathy, we do have more compassion, and it doesn't matter which modality you practice or what I practice, the main thing that you and I have in common is that we care. And what do we care about? We care about the patient. We care about the person we are trying to heal. And we are healers who have, or who advocate proper ethics and respect for our particular patient. So I want to talk about integrative Ayurvedic doctor. Who is this person and what is the scope of practice of this person? So it's somebody who might have done a DO or an DC, and you're all familiar with that, or an ND, or I could explain MD. MD is a medical doctor, DO is doctor of osteopathic medicine, and then you have a naturopathic doctor, ND, or you have a DC, a chiropractic, which I already mentioned, or I think I'm also going to mention a naturopathic doctor here, a DC, and also a DO. And these are different people who have trained as, in these modalities, and now they are looking at something else to incorporate into their practice. So they have to have 2,000 hours put into this. This is very important. And how can they do that? So they will train in Ayurvedic lifestyle medicine. They will do that course or certification. They will also become Ayurvedic practitioners. They cannot practice this particular modality without doing all this. And they need to have extra hours where they have learned pathophysiology of the body, the way the body works, the way it functions. And what will they do? They will use the Ayurvedic philosophy to actually diagnose people, to train them, to really work on them. So what are we talking about? We're talking about correcting the imbalance and making them balanced. And so they will know how to find out the dosha of the person, whether they have ama or not. So what they're doing is they are correcting the vikriti or the imbalance and making them more balanced. And they need to work on the doshas, basically the Agni, the dhatus, everything that we have to, like trained in and we have understood from Ayurvedic medicine. They will use those modalities and bring health and healing to them. But without having extensive knowledge of Ayurvedic medicine, they cannot practice it. So those are important, and they will work on meditation, yoga. They will also do lifestyle medicine on them. And here the whole concept is to bring more wellness to them. And I can give you an example of how I practiced, especially recently because of COVID. I was able to heal certain people who had who were suffering from COVID-19. And what were my real sort of tools, let's call it. Well, I have a knowledge of the pathophysiology of the body as a medical doctor, but I also combined all my learnings from Ayurvedic medicine, because in the last 18 years, I've done over 20 certifications, not only in Ayurveda and energy medicine and massage, and I've done all those. So what I did is I guided people into healing by focusing on lifestyle. And I noticed that people who became sick with this recent viral infection, they had low immunity. They were not sleeping well. They were not eating well. And they had a lot of stress. Now, if I had not actually delved into all the knowledge and all, had not gotten that experience of managing the imbalances I learned of managing in Ayurveda, I would not have given them this. And I know that my Ayurvedic training, where I'm also learning about Dinacharya, and I'm also learning about the circadian rhythm, the importance of that, helped me in giving this extra boost to my patients, and I was able to cure them. 3 of them were my own relatives, and I can tell you with a lot of confidence that by giving them basic knowledge about day-to-day living, I was able to make a substantial difference in their lives. I'm also somebody who does a lot of webinars, and I know that some people from my own community, the medical community, are a little apprehensive about Ayurveda or about this ancient healing modality. But when you try to convince them, giving them examples, telling them about the evidence, which we are able to get now, a lot of times by going to PubMed or also reading many great magazines and journals, they do get the idea. And like Dr. Pratap talked about the predictive, preventive, personalized, participatory, medicine, the names might be different. They're calling it the P4, or they can call it functional medicine, integrative medicine. But guess what? We are all actually giving it different names, but we are practicing the same field in this way. And I think Dr. Sumesh, I liked what he mentioned. It's time for all of us who are studying Ayurveda and come from this field to also become more technologically aware, because we are living in a world of technology. People do not want to go into areas where they get very confused or it's difficult for them to understand something if it's in Sanskrit. And I can only tell you from my own ability, I remember learning Sanskrit, certain words to pass exams. But here it's not about passing exams. It's about making Ayurveda a reality in our paradigm. And so I remember Dr. Shekhar and I, we have been using the Veda Pulse, which was actually the work of a researcher who's done a PhD, Oleg Senskin. He's a scientist and a researcher. And what he's done is he's got this device called Veda Pulse, which we put here on our pulses, and we are able to, it's a functional medicine tool, but we can find out the heart rate variability, and we're able to diagnose the dosha. We can find out, it's like a telemetry thing. We know about all the different meridians, which particular tissue is not working well and all. So if you and I can utilize some tools, which right now are really worthwhile, or they have been scientifically, why not use them to make our lives easier? So coming from this point, I will go to the other training that I've been told to talk about, which is the Integrative Ayurvedic Researcher, IAR. Who is this person? So this person requires, the scope of practice, first of all, is you need 1,000 hours, and you will do your Ayurvedic practitioner lifestyle training, but you are a PhD So you've already got a PhD in health sciences, but you have this experience of doing research. So what you will do is, with your PhD in health sciences and your training of 1,000 hours in Ayurveda, you will put it together and do some research. You could use any element. You could use things like which affect my life, maybe the effect of sleep on my immune system. You could also pick up a topic like, hey, let's see if soya beans, which grow in a mineral rich soil, produce better immunity as compared to a soil which doesn't have the right micronutrients. You could do it on ashwagandha. You could pick up any other herb or herbal formulation and try to do research to see if it works. And everybody who's on this platform must be very mindful. A lot of times, fields like modern medicine are being skeptical about Ayurveda because they feel we do not have enough research. We do not have, we might say turmeric is amazing for health, or astragalus is great, or elderberry should be used for immunity, but do we have enough evidence? So if we did have this particular scope of practice of an integrative Ayurvedic researcher who also had training in Ayurveda and had a PhD in health sciences, they could work very well and give us that particular piece. Now, one thing to be which is important here is the particular person who is an Ayurvedic integrative Ayurvedic researcher is not a medical doctor. So he or she is not practicing modern medicine or conventional medicine, and they are not allowed to diagnose or treat a disease. That is very important. So I would like to end my particular, time here at this conference with just, I think dovetailing on what Dr. Sumesh said, that it's a long journey, and it definitely is a very long journey to our destination. But the thing is, the journey of 1,000 miles begins with the first step or a single step. So let's embark on this step, take that step wherever you are. And I remember I tell people, when you do something, something happens. When you do nothing, nothing happens. So take that first step from wherever you are and just do it. That's the most important thing. Try to contribute as much as you can. And I would also like to add that, I've always felt that integrative medicine definitely, if you want to visualize, is like a soup. So if you look at individual ingredients, they could be Ayurvedic medicine ingredients from different things, whether it's lifestyle, it's yoga, it's meditation, it's the herbs, it's also these herbal oils, aromatherapy. Get all those ingredients and put them together with whatever knowledge you have and make it into an integrative, beautiful field. And I encourage anyone who was on this particular webinar that if you're interested in practicing as an integrative medicine practitioner, definitely go for the option of integrative Ayurvedic practitioner, which is what I practice, and I love what I do. Thank you so much.
Thank you, Dr. Samina, for giving an enlightened information about how, as a physician of an allopathic system of medicine, how you are able to incorporate, and always in our classes also, you always give the insightful information, how from the then integrative approach to health and wellness, you bring the various points to our students as well as other faculties also. And great. And now I would like to share some of the guidelines. We put them together and the website also, and we shared some of the information on the website, and how we are not here to licensing of Ayurveda. Licensing is a separate ball game, and we are going to work on the differently. Now, don't worry about the licensing part. We are working on the first, the scope of practice, whom we have to identify them. What is the way of the qualifications are there, we have to look into that. That is the thing is important here. So these are the various speakers and everything. As you know, that the origin of Ayurveda is AAPNA, is a founding of association of 2002 it started. As sorry, I have to share the screen here. I'm going to share the screen here. Good. Are you able to see now screen? Good. So this was in a 501c6, a corporation, Commonwealth of Pennsylvania, USA. It started as a grown and Ayurvedic and integrative medicine health professionals, students, academic institutions, and corporations throughout the North America and internationally. This is our vision of a AAPNA association to start. And vision is basically our wisdom of sharing of this information. And the sharing of wisdom, extensive education, experience, and diverse backgrounds and collective knowledge of Ayurveda and integrative medicine. AAPNA builds the knowledge across the health professionals to incorporate healthy healing and modalities of Ayurveda and integrative medicine, mainstream medicines. So that is our goal. That is the reason we teach Ayurveda in the medical schools, in nursing schools, midwifery schools, and various schools, chiropractic schools, acupuncture schools. Recently, acupuncture schools also invited us. Ayurveda can be taught in their acupuncture schools. So that way they can find the roots of the various parts. And they contacted us, the directors and the president of the acupuncture schools, they contacted us, can you recommend some of the Ayurvedic doctors can come and teach Ayurveda to our students. So that is way, and strengthen the awareness of the healing science, thereby contributing to bringing the wisdom and knowledge of Ayurveda to everyone. That is not only, it's not an individual practitioners only, it has to be taught to the individual also how to live in accord with the nature of the Ayurveda. So this is our global representation. A lot of people are joined in our organization as the members. This is a supporting membership. These are not professional members. They are some professional members are there. These are the people who are providing the joining into the free membership, and that is 76,418 members from the 134 countries. People are joined in our association. This is the largest, biggest organization in the world, basically, globally, Ayurvedic association, which is showing highest number of practitioner, means supporting members are there. And of course, there are a lot of things we did it in our organization, and I wanted to share with you full screen. Okay, recognizing excellence of Ayurvedic sciences, bestowing the annual awards. We recognize the various experts in the field of integrative medicine as the Ayurvedic practitioners. We are following that one. And also we do the Ayurveda Day, World Ayurveda Day, as per the recommendations of Ayush Ministry for Health in New Delhi, India, international conferences and collaborating of Vedic sciences, not only Ayurveda, Vedic sciences. A lot of people may think about that Ayurveda is not, yoga is not a part of Ayurveda, Jyotisha is not a part of Ayurveda, Vastu is not a part of Ayurveda. No, these are all these Vedic sciences, which are considered Vedic sciences, where you are living. And even when I started my practice also, first of all, I contacted the person who is a Vastu expert, and we ask them, when you are marrying somebody, first what you do, you are finding the horoscope and look into that. That is also science, Jyotisha Shastra. So where you are living, where your companion is there, that is also you are looking for that. And where you are, how you are living, that is also part of the Ayurveda. A lot of Ayurvedic doctors in India, they think that these are all the different sciences, and Jyotisha and Vastu Shastra having no scientific data is not there. So if they don't believe the sun is not there, moon is not there, then means Vastu and Jyotisha is not there. So they have to believe it. Everybody has to believe it. Unfortunately, that is in a very narrow-minded way. They think about that. We have to think about the broad-minded way to incorporate Vedic sciences. But we are not training them as a Jyotishis or a Vastu experts. And offering professional liability insurance. A lot of people wanted to have a professional liability insurance when they are practicing Ayurveda in various countries, and professional liability insurance. This is also called a malpractice insurance. There are a lot of medical doctors and health professionals, anybody can take the liability insurance. That is very important. Without liability insurance, you cannot practice because it is protecting you from your assets and all this. That is a separate ball game, which you can discuss with your attorney as well as a CPA, certified public accountant, and your financial advisors. Those people can recognize you and properly explain to you. And conducting various free medical camps in India and needy people we have done, and also listing of Ayush trained BIMS, MD Ayurveda, MS Ayurveda, PhD Ayurveda professionals, various countries in our website. That is the one thing we have done. None of the organization did it this job. We have done that job. AAPNA has put together a wonderful list of the Ayurvedic practitioners who are well qualified. People are there. We listed there on the website. And there are Ayurvedic postgraduate training programs, people who have completed specialization. As you know that bachelor degree is a 5.5 years degree, then like a similar like a MBBS degree, and after that they do 3 years of master's degree, and that is a residential program, paid residential program. There they do the specialization. There are 21 varieties of specialities are there in Ayurveda, from the basic principles to the anesthesia. So various levels of trainings are there, 3-year programs are there, surgical procedures are there, and Dravya Guna experts are there, Vaishajya Kalpana experts are there. These are the people are recognized, to be recognized. These are called as a World Ayurveda Specialist. We have a list of more than 160 Ayurvedic doctors, not only from India, we have from the Bangladesh, Sri Lanka, and Mauritius. Wherever the licensed profession of Ayurveda is recognized as a full training program, even the Sri Lankan doctors who came to all the way to India, Banaras University and Gujarat Ayurveda University, they studied master's programs. They are also enrolled into this program. And we have created a code of ethics, of code of conduct for the Ayurvedic professionals. First principle is that what we have done like that, do no harm. That is the principle we have adopted. First thing is that do no harm principle. On the basis of that, we always tell the people that what we have to give, what type of supplements we have to give. We need to know about the herb and drug interactions. We are going to discuss a lot of aspects are there. A lot of people, they give left and right, a lot of medications like that without knowing about these things. A lot of people, they think about that Ayurvedic medicines are safe. Anybody can use it. This is a grandma medicine. Anybody can use it. That is wrong. That is conceptually wrong. If it is a grandma medicine is there, then we don't need to have any medical schools. We need to go on to study with the grandma. So this is the medical school, fully established scientific approach training program, fully trained program. That is the reason when we take the students in America and various countries, the bathroom size of the Ayurvedic colleges in bathroom size, what is the bathroom size? That is the Ayurvedic college in America and other places. That means you can think about that 4 rooms is Ayurvedic college in America. That is not a medical school. We need to teach them such a way that we take the students to India where they can see the campuses, university professors, deans, faculties, head of the departments, and various research works, what they are doing, how they do R&D, research and development, how the animal studies they do it, various things like that. They have 100,000 books in each college. That is the way we have developed this MOUs and everything. We did it like that. And we also did it free membership for 134 countries we have developed, and also registration for the different levels of registrations we have done. And also, as Dr. Samina mentioned here, that we have an integrative Ayurvedic doctors. Like for example, a medical doctor, MD, who trained in Ayurveda, can he take the 15 days program? There are a lot of medical doctors, they take the training program, 15 days training program, they can become an Ayurvedic doctor? No. So for example, I know anatomy, physiology, can I become a medical doctor? No. Same way, why we have to give the lineage for that way, like that, we have to create a separate platform for them, streamline for them, that let them call them as integrative medical doctor, Ayurvedic doctors. That means they are practicing of Ayurveda. For example, a patient comes with a fistula in ano. Okay, fistula in ano, what is the limitations and scope of practice, what they can do it. In that, after that, they need to know where they can give the Sharasutra treatment for the expert who studied for the 8 years of medical school who studied, that person, they can refer to that. Similar way, a Ayurvedic doctor who is consultations is doing, if the patient comes to him and says that my eyes are hazy, I don't know what is going on in my eyes. Let the Ayurvedic doctor can examine them properly. Then it looks like that it may be either pteresium, or it may be cataract, or progressive cataract or something. That means he is not going to take a blade and cut his eyeball. So he has to refer to a qualified, licensed medical doctor to refer them to do proper surgical matter. Same thing, anesthetist, he is not going to do surgery. Anesthetist, what he does his anesthesia job. Even though any bone fracture is happened, he's not going to fix the bones. So that way, the scope of practice is very, very important here. That is the reason this conference, this webinar is exclusively conducting for the purpose of the scope of practice, what they can do. Donkey has to do donkey job. The dog has to do dog job. Cat has to do cat job. That is the only thing, that the purpose we are going to tell you here. And creating a special category of integrative Ayurvedic researchers, people who are PhDs. As I mentioned, Dr. Samina mentioned that where they can do research. We have a Dr. Ram Mohan Rao, who is expert in the Ayurvedic practice, a practitioner, as well as also researcher, neurosciences. He does research on the ashwagandha and how it can be helpful for in the neurological conditions as well as Alzheimer disease. He has published in a journal, wonderful journal, and research work. So that is the thing, integrative Ayurvedic researchers who can incorporate more research-based things. We are also created in a global Ayurveda ambassadors who are propagating Ayurveda around the world. We have also created a country and state directors from the promoting of Ayurveda around the globe, and we are also supporting a wonderful online journal, a peer-reviewed journal, Ayurveda Journal of Health in Massachusetts, USA. We are supporting them and creating various levels of gold standard curriculum. That is our goal, is that to create a gold standard curriculum for various levels of training program in Ayurveda and Vedic programs, and supporting and licensing of Ayurveda various countries. So licensing is not a organizational job. Organization cannot give licenses. Individual person cannot give license. License is not given by the individual. The boards has to create, and boards has to be conducted by the government. Government has to structure that one. Then only they can licensing procedures will come into these things. And also, a lot of Ayurvedic practitioners, they studied long time back, but they don't have a continuing education. A lot of medical doctors, anesthetists or medical doctors who has conducted, going to the CME programs, even the nurses and everybody has to go to the continuing medical education, which we call as a professional continuing medical Ayurvedic education. Professional Ayurvedic continuing education we call, and to encourage the providers to do it. A lot of times what they do, they take the courses, for example, Ayurvedic practitioner, they take the one Reiki course, then they call it the continuing education. That is not a part of the thing. They have additional training program they have taken. They have to take into the same field what they are practicing and everything there. That means they are integrating other licenses, other parts of the training program. Instead of that, what they are achieving these things, further levels of training, continuing education, for example, massage therapist, panchakarma therapist, he is taking the extra additional training program, new techniques he is learning in the panchakarma therapies. This is the thing exactly what they needed to do, the PACE continuing education programs. And also defining the scope of practice for the various levels of programs, creating the database of registered Ayurvedic professionals, and recognizing the Ayurvedic institutions, schools, educations, and universities, and conducting an International Yoga Day, World Ayurveda Day in collaboration with. These are the two events we are actively doing. In the International Yoga Day as well as the Ayurveda Day, we are collaborating with the Ayush Ministry and everything, and creating of various national, international alliances. Dr. Chauhan has done this work like that. We have done an alliance with the Jiva Institute and various institutions, organizations, and allied health professionals. And we have done these things, and also following the guidelines of the benchmark training program, which I explained to you, World Health Organization has done, and scope of Ayurveda practitioners for the 21 levels of training, because a lot of people are having various training programs are there. And also we have created the board certification for the registered Ayurvedic professionals. And this is the one of the organization highly supports the BAMS people. That doesn't mean that we are not supporting other members like that. We wanted to have BAMS people to be empowered and taught properly, and at the same time educate the people. They are people who are hungry for the knowledge of Ayurveda. We are here to give the knowledge for Ayurveda. We definitely support them. We encourage all our students to give this knowledge and everything, to support them. And that doesn't mean that we are going to put them on the top of the notch like that. Everybody is important who is incorporating and incorporating into their practice of Ayurveda is important. This is the board certification programs we have done, various board certifications for that, various levels of board certification are there, and also scope of practice for this is the only organization in the world has established 21 varieties of various scope of practices, these things. We put a lot of effort, lot of feedbacks came from the wonderful directors from the schools, and as well as from the advisors. We have advisory board and everything. I will go through that process. And this is the world we are doing, a world Ayurveda specialist. Go to the website called Association of Ayurveda Professionals of North America. In this, only MD Ayurveda, MS Ayurveda, PhD Ayurveda people, and recognized from the institution, qualified institutions, they have to submit their credentials and certificates and everything. We cannot take the people who are bogus certificates, which are online courses. They have taken distant education courses. We don't take those certificates. Okay, fake certificates, we don't validate it. Only qualified people, well qualified institutions only we take them. And then also fellowship, a fellow is there, fellow of American Association of Ayurvedic Professionals of North America. We have a category is there. And also these are the board of advisors, various advisory board members are there. And you can look into that, all 20 people are there. And these are the Padma Shri, David Frawley and Maya Tiwari and Diana Lurie and Suhas Sagar, Vijay Murthy, Anthony James, and Amitabh Guman, and Jayarajan, Jageshwar Nath Mishra, and Pratap Chauhan, Ashwini Kumar Raut, Sonal Bhatt, K.S.R. Prasad, and Bhashwati Bhattacharya, various people who are there in this group, and they are the one, Vivek Shanbag, all the people who are there here, and as an advisory board, time to time they give the advisors to us, and we put the board of advisory board, and we have a highest number of advisory board is there. This is not a one person showing like that. It is a group of people are working together, putting together wonderful knowledge and everything, sharing since 19 years. It's not a 1 year is not established, new establishment, not like that. 19 years we are doing this, tirelessly working on these things. These are the board members. Myself as a president and chairman of the board, and Michelle Costantini is a secretary and treasurer, and board members of Richarita and Zayad Muni and Paul Douglas and Priya, and Dr. Sommes Kaushik is a PACE advisor, director, and Indu Arora, and also other board members are there. Gauri Junarkar and Aslesha Raut and Meenakshi Gupta, Jorge Torres and Satya Dornala and Ram Mohan Rao and Pooja Sabarwal, various people, research work and everything there. Minimum qualification we have came up with these things. This is the word we are doing with the Ayurvedic entry level of program. What is the thing is that all the supporting members of Ayurveda, who loves Ayurveda, who is passionate about Ayurveda, who is the grandmother, mother whispered knowledge of Ayurveda in their ears, they are all eligible to join in this entry level program. But these level of the people, they are not allowed to practice. This is only for their practice, for their self-care. That means Dinacharya, Rutucharya, lifestyle management, and everything they can do it. That is the entry level of the program. That is 500 level of program, Ayurvedic lifestyle consultant. That means they consult themselves, they can take care about themselves. Then Ayurvedic health counselor, second level, minimum prerequisite of they are able to practice, and prerequisite to the Ayurvedic lifestyle consultant. And then next Ayurvedic practitioner level, 2000 hours of program. Ayurvedic doctor, which is having a minimum 4,500 hours of training with the BAMS degree and equivalent training program pre-existing of the Ayurvedic practitioner program with clinical of 2,000 hours of clinical rotation. Internship is required. Various departments, they have to work on that. Clinical rotation is important. And a doctor of Ayurvedic medicine, which is MD Ayurveda, MS Ayurveda, PhD Ayurveda, recognized by the Ayush, Government of India. Those degrees are not valid in Western countries. So that means to distinguish from the medical doctor, MD, and we need to have institute as a DAM, Doctor of Ayurveda, Doctor of Ayurvedic Medicine, that is called DAM, equivalent to MD in modern medicine. DAM degree will provide a clear distinction between the public and medicine, medical professions, and as well as the government. So this is very important, like that. DO is different, MD is different, OD is different, DC is different. So that way, we are going to separate it like that. Who are MD Ayurveda who studied, they can be considered as a equivalent to DAM, that is the Doctor of Ayurvedic Medicine. That they have to have BAMS degree in addition to that MD, MS Ayurveda, PhD Ayurveda, those people. PhD is no problem. They can write PhD Ayurveda, no problem. But the only MD Ayurveda people. Integrative Ayurvedic doctors, which Dr. Samina has clearly explained that integrative Ayurvedic doctors, 2,000 hours of training is required, and pre-existing training programs are required, and integrative Ayurvedic researchers having not necessary that they are practicing, but their clinical practice is very important for them. That 1,000 hours of training is required for them. That is the thing is important. And this is the specialty subjects. Why we have to create a separate specialty? So a first level of the student, whoever parts into the things like that, as soon as they learn Ayurveda, basic level of Ayurveda, they have a calling inside that they wanted to become a doula. Doula means it's a midwifery and nurse, between nurse and midwifery. We will talk about that. Somebody wants to become a polarity therapist. Somebody wants to become a yoga therapist. Somebody wants to become a massage therapist, Marma therapist. So various things, specialities are there. We have created various levels of things like that. The basic knowledge is required for them, which is an entry level of the program, Ayurvedic lifestyle consultant. After that, they can jump into these things. That means 1,000 hours of training they have to acquire. Minimum 1,000 hours of training is required to practice and incorporate Ayurveda into their practice. That means 500 hours of additional training they have to take as a food and nutrition consultant. A lot of my students who are interested to, not to practice, they wanted to become a chef. They wanted to cook the food. They wanted to provide the food and feed the people. The rasa, guna, virya, vipaka, prabhava, and all the various conditions, they look into that. That is the reason we have to give a scope of practice for them, Ayurvedic food and nutrition consultant. In the World Health Organization has put a documentation called Ayurvedic dietitians. Ayurvedic dietitian program is already established, but you cannot call it a dietitian because dietitian is a licensed profession. You cannot call it a dietitian profession. Dietetic Association will object it. You have to change according to the country status where you are living. So that is the thing. Panchakarma technician or Panchakarma therapist, who is a PKT, is a 1,000 hours of training, and we are formulating every level of training program, scope of practice, and as well as a clearly explained each and every level of training, how many hours of theory they have to study, how many hours of practicum they have to study. That is also clearly tabulated form we are clearly explaining. For that, we are requiring various teachers, experienced teachers to come forward and to share the knowledge about that, their experiences like that. Not like putting they need to learn 10 slokas. No, they don't need to learn the slokas. So they need to learn what is the meaning of the sloka, why we are using the sloka for them. That is important. We are not creating the pundits. We are not creating the scholars. We are creating a clinicians, a practitioners who is able to help them. And the same way, Ayurvedic Marma therapist who is having 1,000 hours of training pre-existing of the Ayurvedic lifestyle consultant plus 500 hours of Marma points and Marma therapy points and everything they have to learn. And this is a huge knowledge. Marma therapy is very good. And a lot of people, they take a 6 days course, then they become a Marma therapist. And here is the Ayurvedic yoga therapist. You can go to the Bahamas or Bermuda, then you get a training in weekend, then you get an Ayurvedic yoga therapist. So this is not a certification like that. That is a recreation program. So we have to come up with some standards of Ayurvedic education. That is called Ayurvedic yoga therapist. AYT is with the basic training program. Along with that, they need to know about how they can incorporate these things. They need to have a little bit of more extra licensing of procedures are required for that, for the physical therapist or chiropractic, somebody who is incorporating yoga therapy also into their practice. Ayurvedic doula therapist is called a specialty training of Ayurveda with the doula training program, and Ayurvedic polarity therapist and Ayurvedic herbalist. So we have already structured the program, all entire Dravyaguna, and lot of Dravyaguna points are only plants which are available in India. Lot of people, Ayurvedic doctors, may not know about what is the benefit, what are the benefits of the echinacea, astragalus, and kelp, kava, various plants are there which are growing in the various ethnic countries and various European countries. These plants, they need to know about rasa guna vipaka, and very clearly they need to know how they can interact with these things. They need to know herb and herb interaction, a drug and drug interaction. These are all the things they will study very well in the herbalist program, in the 500 hours of full training program they studied. Ayurvedic pharmacist, everybody is formulating the formulations like that nowadays. So we need to have a clear pharmacist who can create the various levels of formulations. Yesterday I was talking about that, how Dhumapana will be helpful for the Alzheimer conditions. So Dhumapana, how the pharmacological action, pharmacodynamic action of the Dhumapana or smoking therapy can influence these things. What type of things can be used? Can we use a Calamus root? Can we use Jyotishmati root? Or can we use Jatamansi or Valerian? What type of Brahmi, what type of herbs can be used to fumigate into the system, how fast it is going to happen, and how the pharmacological, pharmacodynamic action is happening, how the formulation can be made. These are all these things the pharmacist can learn. Ayurvedic psychology consultant. Anybody cannot become a psychologist. There is a licensed psychologist in America. So particularly they need to have a licensed psychology certification is required. That means they need to be a licensed health counselor, licensed psychology consultant, or psychology consultant. In addition to that, they can take the additional 1,000 hours of training in Ayurveda. They can be considered as an Ayurvedic psychology consultant. Ayurvedic psychology, a lot of psychology is based on the philosophy and Bhagavad Gita and all the samhitas and everything is there. So sattva rajas tamo guna, sattva vajaya chikissa, daiva vipasa chikissa, all the various chikissas, treatment aspects are mentioned in Ayurveda, those things. And again, we have an Ayurvedic spa and beauty therapist. This is the beauty is that there are a lot of people who are becoming, again here, a cosmetologist and aesthetician. These are the two people are licensed in various countries. So some countries they give a certification, they have a registration boards are there. We need to work with them. They need to have an extra traditional training program is required for them. Our goal is that to train the Ayurvedic doctors can train the spa therapists who are psychologists. There's a big group of psychologists are there. They are interested in the holistic psychology. They can incorporate the psychology, and same thing beauty therapies and spa therapies. That is the thing we need to incorporate. And here, these are the three important factors are there. Vedic Vastu consultants. The Vedic Vastu consultants are very important that the construction of the house, how you built it, according to Vastu Purusha, according to Vedic knowledges and everything. Basic knowledge is important. Otherwise, what is happening? Now, recently they study one day class or 2-day class, they become a Vastu expert. 4 books they buy from the Amazon, they become a Vastu expert. We don't want that type of people. We need to have a full training program. We are putting a training program for the Vastu expertise like that. So for that, we have a group of people are here in this platform. We have licensed architects are there. Licensed architects, what they do, they have to work with them, Vedic Vastu consultants, they train them and they can work with them how to build properly and everything. There's a licensed builders are there. They cannot build the house like that. They have to give the zoning, coding and everything. They need to know about that. So these are the things are very important. Anybody cannot become a Vastu consultant. Vedic astrology consultant. Vedic astrology consultant is also similar way like that. We have an Shiastu and tarot readers. So many people are there in the psycho readers and all the people are there. We wanted to have Vedic astrology, the dynamic science, the defined science. I have some experts who are there. They studied like a medical school like that. 8 years of medical school, Vedic astrology school they went. We are incorporating with them. We wanted to create a 500 hours of a full training program. How the planetary influence, natal chart, how they influence on these things, and when they have to refer the patient to the astrology consultant. But what is the scope of practice? We are also putting that one. And then again now, meditation and spirituality instructors. I told you that if you are a software guy, you lost your job and you grow your beard and you put a saffron clothes, then you become a guru. Change the name. And then this guy become a scandal guru. And he will give a private sessions for the young ladies. This is gives a bad name for the country, bad name for the science. And poor people who are there, I have evidence these people are there. These are the scandal gurus. I call them scandal gurus. Why? They need to be licensed. They need to be imprisoned. This is the wrong thing. That is the reason they need to be, what is the scope of practice? We are putting very clearly that we have done like that, properly like that. They need to have proper understanding. Recently, somebody learning the meditation technique, he is having a breathing problem. And this guy is saying that, okay, you have to do this time 400 times. He fainted. He doesn't know what to do. Is already vata imbalance is there. You are asking them to do 400 times of breath work. What happens? That is good for the kapha person. He need to know what is the body types, what type of things are there, how we have to elect it such elective way, such a way that this is called meditation and spirituality instructor. Then one of the guy, I asked that, Dr. Shekhar, I'm expert in meditation. I studied in Himalayas. Where you studied? No, I don't have any guru. The rocks and stones and plants are my gurus. Wow. And then what he says that I spent there and I got a beard, I got a saffron clothes. Now I'm a guru. Now I can teach meditation. This is the thing. Like if you go to the doctor, medical doctor, who is a cardiologist, who studied online course or spent in Himalayas under the tree, and he wanted to do surgeries on you, pacemakers and everything, he wanted to put it. You wanted to go there? What a shame to us. We are educated people. We need to, that is the thing what I wanted to tell you, that first of all, you need to, before going to the embark into the consultation with any other any practitioner, ask their qualifications, ask their educational background, ask their experiences. That is the thing is important. Not like simply saying that how many robes are there, how many clothes are there, how many colorful papers are there. That is not important. How many chakras balancing and everything. It's not like a chakra balancing, chakra screwing and tightening. It's not like that. It is a science, divine science. Recently, one of the patient came, Dr. Shekhar, my Kundalini is awakened. I said that I am not expert in that field. Clearly, I mentioned that. I don't know what is Kundalini, how it is Kundalini explained like that. Whatever you are feeling, probably you have a lot of issues of the psychiatric problems are there. First of all, first, have you seen the psychiatrist, qualified psychiatrist? I don't want you to see the psychotherapist who is not licensed. You can see the psychotherapist who is licensed. He can guide you to give the medication. So what we needed to do as a qualified Ayurvedic doctor, what I wanted to do, I wanted to refer to the lot of psychiatrists, MD psychiatry, specialized bench. They give the medicines. I recommend them to them. Doctor, I am recommending this patient, please take care. He may give the Zoloft, Clonopin, or any medications like that, whatever the things are required, he give it to him. Then he will also work with the yoga teacher. Go and work with the yoga, practice yoga. Yoga is unification of the mind and body. So we send them to the yoga teacher. Then once he started to feeling of 3 months betterment is there, then we can start working on that. Simply by putting a tattoo, Om tattoo on your body, then you are not enlightened soul. By putting an Om statue in your head, then you will not become an enlightened person. We need to have a qualified people are there. We are not here to embark and endorse the quacks. We wanted to have well-qualified people who are well-trained people. We are wanted to do this platform like that. We wanted to help them. That is our goal. The scope of practice for the various levels of training as per the guidelines of the World Health Organization, Government of India. We are always constantly communicating with the Government of India, Ayush Ministry and everything. As I told you that Ayush Ministry does not know anything about Ayurveda, what is going on in abroad. various countries. Even I traveled 30 countries. I don't know the whole world. Recently, one of the participants in this class, she's Australian. I don't know. I never practiced in Australia. I told that, yes, we will give the guidelines. You modify it according to that. You put the training program according to your country. Like a Pakistan, different training programs are there. In Bangladesh, different training program is there. In Korea, different programs are there. Mexico, it can be different. You have to follow the guidelines of the state arbitrary training programs and laws and regulations like that on the basis of that. So that is the way it works with us. We are not giving a standard program we created. As our board of directors and advisors put together nice programs, and that can be modified according to that. Like a glass of water, we give it, you can put in a spoon, you can put in a cup, you can drink with a straw. That is your way of taking, but the knowledge has to not to be dispersed, not to be diluted. That is the only way. Dr. Sommes Kaushik also mentioned that one of the patients became an expert in Ayurveda. So that type of things we don't accept it. Scope of Ayurvedic practitioner, Ayurvedic lifestyle consultant. This is the thing, entry level program we are talking about that very clearly mentioned. If you need to know about more detail, all the information is posted on the website, and they do not diagnose and treat the diseases. They do not diagnose the diseases. That is a self-care. Lot of people, I ask them that dinacharya means 4:30 they have to wake up in the morning and go to bed at 9 o'clock. How many Ayurvedic students are doing this work? And how they are following the dietary, dinacharya, rutucharya and everything that. This is the thing is important. A lot of Ayurvedic doctors in India, they don't follow. They are the smokers, they are drinking, and at the same time, they don't follow the time. It's a shame on the country like that, people like that, doctors like that. And when I went to the Banaras University, and morning at 9 o'clock they put a schedule, and 11:30 they put a high tea. And 4 o'clock they are eating lunch. And 11 o'clock they are giving dinner. That is Ayurveda Dinacharya mentioned. Why? Why we are going to be diluted like that? And another thing is that we always teach our students that always sit and eat. No chair in the dining hall. Everybody stand and eating. Why? Why we need to do? What a shame on our country. What are the institutions? This is the thing platform I wanted to tell you that at least arrange the tables. Silence eating. In America, we teach them how to eat silently. Silence eating. How to eat also we have to teach Indians. How to sleep we have to teach. How to eat also we have to. How to behave also we have to teach. This is the behavioral medicine we have to teach them like that. They know abundance of slokas and knowledge. Encyclopedia of knowledge. Charaka they can start, and Ashtanga Hridayam they can by heart it everything. But the thing is that they are not practical. This is the thing we need to show them that Ayurvedic lifestyle consultants can embark this part. Sir, lot of students, sometimes if I am standing, my mistake, I standing that, sir, you are standing and eating. This is the word students say that. It is slap on my face. I sit and eat immediately. I don't argue because I did a mistake. So this is the thing is very, very important. We have to teach. Health counselor. How health counselor is that 1,000 hours of training. That means they can collaterally work with the qualified Ayurvedic doctors, chiropractors, health counselors or practitioners like that. They can independently practice, but basic level of the training, they don't incorporate more levels of the things. They know about the light spices and condiments and health counseling and incorporating of the principles, what they are doing, what they are benefiting like that. This is the health counselor, 1,000 hours of training. Next level goes to the Ayurvedic practitioner level is that 2,000 hours of training they have an closely connected with the Ayurvedic doctors. They can work with them as a physician assistant. Like we have a physician assistant program is there. There is like a similar like that. We have an Ayurvedic Ayurvedic practitioners like not independently they are practicing. They are always connecting with the health practitioners, Ayurvedic doctors, chiropractors, other doctors. They can work with them. Ayurvedic practitioner level. Now come to the Ayurvedic doctor. who is a BIMS doctor or higher qualification people, BIMS people, and also in addition to that, they have to also having integrating in the laws and regulations of the way they are practicing, but they do not practice conventional medicine. They do not practice conventional medicine. That means allopathic medicine they're not allowed to practice. They have to practice only Ayurveda. In conjunction with that, they may have some other prediction. This is the thing, when we are getting licensing part, this is the thing they have to do it. They can be on par with the naturopathy doctors, on par with the chiropractic doctors, on par with the DO doctors, on par with the, this is the way we need to go. And further level is that DAM, Doctor of Ayurvedic Medicine, who are having a specialization, a master's degree, who has completed 9 years of medical school in India and other parts of the world. Those who are having a specialized knowledge and a specialist of the information, everything is there, MD Ayurveda. They are also not practicing individual conventional medicine, but they are individually practicing the Ayurveda principles and everything. They are working on that DAM doctors. Then, as we mentioned, the IADs and these are the integrative Ayurvedic doctors, which Dr. Samina has explained that, and researchers, how the researchers have done various levels of research work they can do. Health sciences is very, very important. Like for example, somebody is a physicist. He doesn't have any connection with the PhD, with anything. Chemistry, computer guy, PhD. Can he practice Ayurveda research? No. We have to have, he has to have a bio health sciences. Bio health sciences he has to study. He has to study Ayurveda. Then only he can incorporate Ayurvedic research. He need to know basic understanding. He need to recruit the qualified Ayurvedic doctors who are MD Ayurveda, MS Ayurveda people. They can collaterally work with them. Then that is the way we can work with them. That's the thing. It's an integrating. That's the thing is important. I'm not saying that integrative approaches we have to approach like that. A lot of times my friends who are medical doctors, they always ask me, Shekhar, what do you think about in Ayurveda? What do you think about acupuncture? What do you think about chiropractor? A lot of chiropractors they come. We have collaterally referral programs are there. Some of the people who are having some scoliosis problems are there. I'm not going to give a katibasti and all these things is going to fix the problem. I tell them that go to the chiropractor. He will adjust it first. He will see the X-ray part. He is going to look into all the details. Then we can work on that in connection with that. Then I explained him about the Katibasti, Merudanda Basti and everything, various therapies like that. Wow, this is a fascinating knowledge. Shekhar, can I refer my patient to you? Then can you work on that? And I will back to see and how the changes are happening in the X-ray. This is the way we have to collaterally work together and support each other and respect each systems of medicine. That is the thing is important. We have nurse practitioners are there and midwifery is there and various groups of people are there and they can come work on with that. So as I mentioned to you, Ayurvedic food and nutrition consultant able to work with this Ama, Agni, Srotas, and also they can work with the food as a medicine. They can work with the registered dietitians. And I work with a registered dietitian and she always fascinates that, wow, this is, we have not studied. We studied only calories and vitamins and minerals. Now you are bringing the different part of these things, rasa. So when you are drinking glass of milk, I drink vitamin D. You don't tell like that. You drink milk. And we call that milk is a madhura, sweet in nature. And the Sleshma Vardhaka means increases the kapha in the body. So when your Agni is weak, you are not supposed to drink milk. But if you wanted to drink milk, it has to be heated. It has to be used with spices. And samskara has to be done. And then only you are allowed to drink milk. That is the way the food and nutrition consultant will be able to tell the intricate part of the way of digesting the substances is very important. So it's clearly mentioned in Amena Tena Samprukta Dosha Dushasya Murchita. That is the word we use it very clearly. So Ama is the culprit of the creating of all the diseases. And we don't work on the Ama. How many medicines we give, no use. So Panchakarma therapists and Panchakarma technician, they should have a closely work with the Ayurvedic doctors, and also must have a massage therapy license is required. Why? Because to touch the person, you need to have massage therapy license, and either body work or massage therapy license is required. And then you are incorporating Ayurveda new techniques, a Pinda Sweda or Patrapotali Sweda or Shirodhara or anything with Hrudbasti, Netrabasti or anything you are doing, particularly you are working on that way, you are helping them like that. Next, Ayurvedic Marma therapists, this is the specialized branch. They can closely work with surgeons, plastic surgeons particularly. Plastic surgeons and rhinoplasty, who is Sushruta has done, they can closely work with them. There is a specialized branch. Even the Ministry of Ayush, we are strongly working with them and telling them that to develop the special curricula for the Marma therapist. It is lost, knowledge is lost. It has to be explained very clearly. Only certain parts of India, they practice very well, but not many people are practicing. There are 107 Marma points are there. And acupuncture medicine, the Chinese system of medicine has based on the Marma therapy, and they have developed very well. Whereas we are not able to develop completely, the full system of medicine is not completely developed. It needed to be more expanded, more clearly, more research has to be done. Then Ayurvedic yoga therapist, yoga teachers are there. 70,000 yoga teachers, registered yoga teachers in America. 70,000 yoga teachers are there in the Yoga Alliance. And in addition to that, yoga therapists are there. So there's an international yoga therapist association is there, IAYT. That is also certification of these things. These are the organizations, they don't give licenses. The only certification they give. None of the organizations cannot give licenses. Remember that if anybody saying that AAPNA will give license if you join in that, that is a rubbish. That is wrong. Similar way, AAPNA will not give licenses. American Medical Association will not give licenses. There is a separate board is there. There's a board examinations are there. That is the organization they give, set up all the examinations and everything. This is the thing is very clear. We need to clear cut picture of that. And when I join the Ayurveda Association, $150 I pay, and then I will become a licensed? No, you will not get license, $150 license. Then everybody will get licenses like that. So that is the thing is very, very important that yoga therapist as an individually, they have to work with that registered yoga teachers or certified yoga therapists. They can also work with must have some training program is required. They have to work with them also. In addition to that, they need to know about the dosha, prakriti, vikruti and everything that assessment like that. Ayurvedic doula therapist, a certified doula provide guidance, support for the pregnancy women during the labor. And these are not licensed midwifery, and they are not, there's no licensing. Certified doula therapist is giving a support. This is called dadi. Dadi means who is supporting the pregnant woman, and also physical support and moral support, and as well as during and labor and childbirth according to the Ayurvedic science and philosophy. She can read a book of Ayurveda. She can read about the knowledge about Ayurveda. She can teach about the lifestyle management, proper diet and soup and everything. Manda, Peya, Vilepi, all types of diets she can follow like that. All the various things they can work on that. They can also cook various nutritional foods in different stages of the pregnancy. So this is the thing is also important. A doula therapist can go to their house, they can work with them, they can work with, that is our scope of practice, who can do it like that. And Ayurvedic polarity therapist, they also is the offshoot of polarity therapy and acupuncture therapy is developed. Polarity therapy is developed from the offshoot of Ayurveda and acupuncture therapy. This is called Ayurvedic. Amadia Morningstar, who has written a wonderful book on the Ayurvedic polarity therapy. This is the thing is that a very good balancing of the physiology more with the yoga, exercise and realignment and nutrition, various things. And they can be worked with the massage therapist, physical therapist, chiropractors, osteopathic doctors and holistic health practitioners, and they must have some license, some sort of license is required, like a like a chiropractor or a nurse practitioners or massage therapist or something like that. They need to do incorporate this polarity therapy is very important. Ayurvedic herbalist. Ayurvedic herbalist is very, very important to know about the herb and drug interactions, herb and herb interactions, and dosha dhatu malas, and subtle energies such as sattva, rajas, tamo, gunas, and everything. Nobody is able to identify that. Ashwagandha powder, if you get it, whether it's sattvic, rajasic, or tamasic, nobody is able to tell. Why? We don't have parameters. We talk about that. But what is the toxicological knowledge about the various herbs? Like there are herbs, are there certain herbs? Recently, one of the patients said that, Dr. Shekhar, I put datura metal juice in my eyes. Why you put it? You are not supposed to put it. Because this is the tradition, then you will become blind. That is called Upavisha in Ayurveda. Datura is considered Datura, Karavira, and all the Gunja, all the herbs are purely, clearly mentioned as Upavishas. That means it has to be purified. They have to be purified. So this is the way herbalists should know all the various levels of training programs and everything. Ayurvedic aromatherapist. Aromatherapy, when I was in Europe and in Germany, Italy, France, Switzerland, various countries, and they use a lot of aromatherapy as a healing modality. Healing modality in the things, various herbs of Gandha Chikitsa. In Ayurveda clearly mentioned Gandha Chikitsa. This has not developed in India. And this is the specialty branch, is that Ayurveda is going back to from America to India. That is going to happen. So that is our goal, to spread the knowledge of Ayurveda in the world. That's the thing. And able to formulate, make single and special blends of the oils and recently, by mistakenly I put in 2 types of oils. It becomes a foul smell. They both are looking good, but when I combine together, it is having a foul smell. So that means you cannot combine 2 things together. So you need to know what type of oils can be combined together, what combination can be put together. Like in a chocolate ice cream, putting a ham. Chocolate ice cream, you are putting a ham or a fish. It won't fit. Fish chocolate. No, we don't have fish chocolates. So that is the way we have to know about that, what combination of the oils and everything has to be used. Ayurvedic pharmacist should know about the various herbs and dosages, side effects, herb and drug interactions, herb and herb interactions, indications and contraindications of various formulations. And a lot of people know about that. Avipattikara Churna, for example, we know the indications. What are the contraindications? We don't know. We don't study much. The college will not give much information about that. And Hingvastaka Churna. Hingvastaka Churna is contraindicated in hypertension. Because highest amount of salt is there, salt is contraindicated. So Hingvastaka Churna is contraindicated in also edema condition. Generalized ansarka. So a lot of people, they don't know about that. Licorice is contraindicated in the hypertension. So these are the things they need to know. A pharmacist should know about all the pharmacological action of the every herb and everything. They need to explain to the properly and everything like that. Ayurvedic psychology consultant, APC, which is must be a mental health counselor. Mental health counselor. We have some BAMS doctor who have also studied mental health counseling. They are licensed to practice, and at the same time, they are also incorporating Sattva Vajaya Chikitsa, the client mental health and individual health, Sattva, Rajas, Tamo, Gunas, and everything. They are following these things. Then finally, spa and beauty therapist. And scope of practice is that spa beauty therapist emphasizes the educating the client's importance of the proper diet and lifestyle and beauty. A lot of people think about that putting the makeup or something is not going to become spa therapist. They need to change the diet inside also. They need to change the diet and everything. This should be a licensed esthetician or cosmetologist should have a background of Ayurvedic lifestyle background is required, then only consider as an Ayurvedic spa and beauty therapist. And Vedic Vastu consultant, which is an elegant and a practical, they have to work with the licensed architect and licensed builders. This is the thing is also very important. The licensed builders and licensed architects, they can work on that, and they can give aesthetic way of looking for that, Vedic way of Vastu way of construction like that, and Vedic astrology consultant, which able to recommend some of the mantras, yagyas, yagas, and talismans and various things. They can do it, and they can have and provide Ayurvedic medical astrology consultation. They can also provide it. Very effective, simple remedies, astrological remedies on the basis of the natal chart and various things like that. They can provide it. And as I mentioned to you, meditation and spirituality instructors, the scope of practice very simple. They can also involve in the research work, like for example, a meditation teacher and like a transcendental meditation and any meditation technique. They can involve into that. What is the neurosciences, what changes are happening? Harvard is interested in the more and more research on the brain functioning. These researchers, these meditation teachers can work with them according to the doshas, according to Agni, according to different kind of body conditions. They can give the mantra chikitsa and various types of chikitsas. They can do it through the meditation and spirituality instructors. So that gives why we need to come up with licensing, very important. This is the separate chapter we are going to discuss. Time is up for us, and I am going to take some questions and answers for that, all of you. And I stop here. We have a lot of questions are there. And so what are the charges for these courses? No, charges are different. We are not charging any courses here. Here, individual schools are running these programs. We are going to create a platform of the training program. AAPNA is not giving a training program. AAPNA is a body which is structuring the program, and that program, which is followed by any school, can run the programs. First of all, we need to structure the program. First, to structure the program, then only we can aesthetically modify it according to that. For example, you builder give them a building, then you have modification can be done inside. Whatever the modification, you can do it. You wanted to have carpeted, you wanted to have slates, on various levels you can do it. How much amenities you can put it together. But the thing is that very important here, we have experts like Dr. Somesh, Dr. Samina, Dr. Pratap Chauhan, and all the various, Dr. Aparna Bapat, various people are here, well-qualified people are here, and those people can guide us, put them together. And also, not only that, we have wonderful teachers from India, and Vinamra Shamra is here, and various speakers who are participating there and participating. Then what we needed to do, we wanted to put a program together according to structure. So there is a way that chapati can be made according to the quantity of the bread. So I give 1 pound of bread, but you have to make 50 pounds of bread. How can you make it? It's not possible. So it's a very important here. In 500 hours, and Dr. Sommes Kaushik, what he mentioned that clinical importance is important. A lot of people having a theory knowledge is there. Clinical importance is missing. That is the reason we are not able to successfully practicing. So, for example, 150 hours of theory, 350 hours of practicum part, that gives a more strong foundation. Make sense? Otherwise, 400 hours of training or 450 hours of theory and 50 hours of clinical orientation. And at that clinical orientation, they are on the vacation, Niagara Falls or somewhere they are sitting there, and they send only 2 hours in the class. Remaining time they are watching the Niagara Falls. A clinical orientation is done. That is not a way. So that is the thing is happening, that mainly that nobody wants to everybody wants to have a shortcut. They want to have a piece of paper to bluff the public. How long we can bluff the public? How long we can cheat the people? We are white collar cheaters. We don't want to become white collar cheaters. We wanted to be qualified people and well-known people. A lot of people, they ask me that, Dr. Shekhar, are you a medical doctor? No, I am not a medical doctor at all. In my dream also, I am not thinking about a medical doctor. I have friends who are their medical doctors. You can go and see them. Are you a chiropractor? No. Are you a naturopathy doctor? No. These are all varieties are there. I'm an Ayurvedic doctor. That's it, simple. And remember one thing. If you tell lie, you have to remember a lot. If you don't tell lie, you don't need to remember anything. You don't need to remember anything. Even in the sleep also, you can tell everything clearly. That otherwise, if you tell lie, you will die soon. You will die soon. Your heart will block. Sadhaka pitta will be affected, and everything is gone. You are no more. Don't lie. Treat, respect, and knowledge will be shared. And here we have some questions here. Thank you very much, Dr. Samina.
Shekhar, do you mind if I ask a question? I put
Yes.
my hand up. I don't know if you
Yeah.
saw it. I might have to leave at any moment, so I wanted to make sure I got my question in.
Yes.
I have a question and a comment. So my question, well, I'll do my comment first. I'm trying to decide, I have an Ayurvedic practitioner certification, and I'm trying to decide if I'm going to pursue an Ayurvedic doctor training. However, it's a lot of time and it's a lot of expense, and then there's the whole clinical internship portion that requires in-person training, and so there aren't a lot of opportunities local to me for that, so that means I have to also spend a heck of a lot of money traveling. We have coronavirus. I am not convinced that this is going to, coronavirus lockdowns are going to end in September. I think we're going to be having these issues for years. So I'm currently in talks with one school to find out what my options are in terms of completing the internship portion, because I'm very concerned about my ability to do that. And I don't know if there's enough demand here yet in the United States to justify my spending all this time and money in order to get that additional training. So part of the challenge I think Ayurveda has in the United States is to let people know that it's there, to have more training programs that have it in different cities, so we can have more affordable training options. Otherwise, it's only going to be rich, bored people who are doing it.
I'll tell you for this. I'll tell you a reason for that. Because these structured programs are there. How they created, they are man-made created courses. These are all people created by their own structure, their own organizational way they did it. Every school, they can call the Ayurvedic doctor, Ayurvedic expert, Ayurvedic specialist, Ayurvedic guru, you can say any word, okay? But the thing is that you have to look into that. You have to do homework of that. Take the benchmark training program of the government of India, and Ayush Ministry has given the document of 22 pages of document which is posted on the AAPNA website. You can ask the school that does the teacher, who is the teacher who is teaching? Dr. Sommes Kaushik is mentioned that there are so many schools who are my students. I taught, I don't want to mention any schools' names. My students who learned my course material, my manual, and they are becoming teachers now. And they are teaching the course of my material in their school, and they are the teachers. I am not going there. So that is a pity situation. First, you need to know when you go to the restaurant, who is the chef? What is the amenities? Not look into the college name. First, you need to know who is your teachers, who is the amenities, what is the clinical setup is there, what type of clinical setup is there required, and whether they are providing this type of things are there. You have to ask all the questions put together to the school. If they are not giving the proper answer to you, that means that school is not fit for you.
Oh no, so the first school, the first school I went to wasn't that great.
I will tell you. For that, what has happened recently, one of the student, my student, who came to India, 1 month training program, then after that, she is 40s. She's 40 years. She's a master's degree. She has already studied massage therapy, acupuncture training in 2-year program. She finished it in 18 months. She finished her program. Now Government of India, she said that, Dr. Shekhar, I am going to study BAMS course in India at the age of 41. 41, I got admission in the SDM college in Hassan, and the Government of India, full ride. That means she doesn't need to pay 1 penny. Even the flight tickets the Government of India is bearing for her to go to India to study 5 years of BAMS course. Even accommodation, food, everything is covered. And what she said that, Dr. Shekhar, what you said, I have asked only one challenging question. Are you ready to jump into the ocean? There are barracudas are there. There are crocodiles are there. Are you ready to jump and swim? Yes, she said that I am ready to, I'm a fighter. I can go. At the age of 48, I become a BAMS doctor. And with your blessings, I will do MD also Ayurveda. At the age of 50s, I'll finish my MD. Then I said that, so this is the thing, Stephanie, I know you, don't compare with other schools. You are comparing with the one apple to the other apple. Gala apple to the Macintosh apple. Macintosh apple to the Fuji apple. All apples are same. You need to see, you have to ask all the questions and what training program you are there, what you have taken the full training program, Ayurvedic practitioner level, how many patients you are able to successfully treat the people with the Ayurveda. How much change you brought it. Have you seen 5,000 patients?
No.
And if you are not seen 5,000 patients, why you need an Ayurveda doctor degree?
That's what I'm asking.
No use of other degrees. What you do, you are acquiring stamps of certificates like that, hanging certificates.
Well, I wanted to get better training so I would be better. And my,
what you have earned,
Mhm.
you practice. And Dr. Somesh is here. And Dr. Somesh, I will be apprenticeship with you in your clinic. I will pay for you and I will come, I will study under you and I will get more certificate, more training program and clinical experience, I will get it. That type of thing, clinical experience, you have to get it because you learn a lot of theory. It's more than enough for you. You can write a very good books. You will be a good author. You are a good writer. You are a good writer. You are a good speaker. A lot of things are there. Your amenities are different. You need to have a clinician practice means I wanted to have you to go on the clinical experience, you do it. Otherwise, I will throw you in India and go to India and completely study Ayurveda 5 years program BAMS course. And there are wonderful teachers. Vinamra Sharma is here. Dr. Vinamra Sharma is a professor in the university and he will recommend you and will recommend you. We have a lot of colleges and universities. I am the professor, associate professor and adjunct professor and emeritus professor of the various universities. We will recommend you good institutions where you are interested to go and you can embark studies. There is a program is called completely, lot of students, every college in India, there are 1,000 colleges are there. Each college having 2 students, 2-3 students from the foreign nationals can come and study Ayurveda in India. And now students, lot of schools are not able to recruit the students because not many, demand is not coming. Recently demand is coming, more students are coming. I can see the South America, South Africa and South Korea and Zimbabwe and Turkey and Canada, USA, all the students are going to India to study full study program. If you wanted to study Ayurveda, who is very well trained, like here Robert Swaboda, who studied Ayurveda, fully trained. Dr. Jessica Velala, BAMS. We will recommend you Jyoti Bhatt, who is there. And there are students are there. We'll recommend you that names and you can contact them. What is the journey of that study of Ayurveda? If you are decided to study full form of Ayurveda training program, that's the thing. But again, question comes here. When you come back here, again, 0, it starts. That means you need to have massage therapy license or acupuncture license or naturopathy license. I recommend you, what you studied Ayurveda, go to the acupuncture school and study acupuncture and combine together.
Yeah, Just another quick question. Are you ever planning on having examinations like Nama does? Like I took an exam with them for
We'll
my.
talk about that. That's a different part of the things. The examinations conducted by the home program. This is not governed by the government of anything like that. It is a self-regulation. Like you are going to your house and your husband asks that you need to come and knock the door. Without knocking the door, you cannot come inside. That's your regulation. That is self-regulation. And we are not here self-regulating. We wanted to create Dr. Sommes is here. He is expert in that field, board certifications and various things like that. It is not like that. I'm a board certified. What is the use of it? Board certified means people laugh. Dr. Ravi will laugh at that. Because board certification means 3 years you have to go to the medical school. That is called a board certification. This is not a paper giving a board certification. Examination, 10 questions answered. Out of 10, 5 answered correct, then you are passed. That is not a board certification. So there is a lot of things that Dr. Sommes Kaushik is interested to speak about that. Dr. Sommes.
Thank you.
If you are looking for a place to study, then you really have to contact few schools where not only you are looking for a qualified faculty, you're looking for people who have seen patients, who are actually clinicians and seeing patients every day. And also, if you're looking for certification, at this point, there is no board which certifies people. It is basically a test which Nama gives or the agencies can start giving, but that is something that should not be the case. You should be looking for a place where you can get authentic education first.
Good. So it's very interesting questions. A lot of questions are there, but we will address these areas of. Now this is the area platform we are thinking about scope of practice. First scope of practice, we are creating this one. Then after that curriculum will be started. Then clinical rotation will be started. Then after that, these different levels will come up. But until that, we are all in a dilute of the bubble. We are in the bubble. We are always in the, no structured program is there. No institutions are well, as Dr. Sommes Kaushik mentioned that, this is the thing, clinical training is important. Without having a proper clinical training is very difficult. Students has to undergo these things. Dr. Anthony James, he is going to one of the board of advisor. He is going to talk about that, his practice and everything also.
Yeah, hi, and Dr. Shekhar, first, real quick, thank you so much for putting this group together. It really is an amazing format that we're able to do this. And actually, I had this question before with Dr. Chauhan, which is, he has not been able to host a live training listed on his program since last year. And because of the lockdowns and because of other things like this. So we've had a lot of issues with students who are not able to travel, or who, if they did travel to do a practicum or clinical, were then required to do some kind of lockdown or quarantine afterwards. And it actually has had a huge impact on the school, on the practicums. So do you have any ideas or suggestions? This is for Dr. Sommes also, because I think all the schools are having this experience right now.
Yes, for that, what is the thing is that you need to talk to the other schools, such as medical schools, osteopathic schools, naturopathic schools, acupuncture schools, how, because COVID is affected everywhere, how they are managing. Like my son goes to the engineering school. He has a lot of school programs are there when they are doing. What they do, they have a program there. They have to mandatory mask, they have to come, take a limited number of students to take the classes like that. That is the very best way to do it.
Right.
A lot of things can be shown online and a lot of things can be shown in person like that. So that is a lot of things can be done. You have to take the parameters of the other schools, what they are doing, because pandemic is affected all the levels.
So what I want to say is that's what we are doing. what we're doing though is we've shortened the practicums so they are modular and only 2 weeks at a time, actually 13 days. And that way, over time, we can get our 1,000 hours in class, hands-on, and that kind of thing. I was just curious what maybe,
Yes. So
I didn't know if there are other schools online right now in this call, but I was just curious how they were handling their practicums.
So that is the thing. Is that one question is came that the clinical experience as a health consulting is considered as a clinical experience. You need to ask this question, same thing with the medical doctors, medical training program, MD students who are going to this program. They are also going for the clinical training program with the masks, mandatory vaccinations and everything. When their mandatory vaccinations are there, then they can go for the clinical training programs mandatory like that. So you need to follow the protocols and COVID protocols, then you can do it. Yes.
So medical school, naturopathic schools, they are doing some basically telemedicine, and especially last year majority was, but again there are some there is some training where you cannot learn anything by telemedicine. For example, if you are giving say, acupuncture, it has to be in person. If you are giving IV therapy, it has to be in person. If it's going to be a minor surgery, which is taught in naturopathic schools, that has to be in person. So, but again, only thing is you basically make sure that you follow all the CDC guidelines by mask and again, of course, gloves. But in generally, doctors are seeing patients. We were never closed. I was thinking that when the COVID started in March of last year, we may have to close, not even a single day. Actually, what happened, we had to open on the weekend. So 7 days a week. So of course, the masks were important. Of course, we take the temperature of the patient when they come in the clinic. And same thing with the students. We make sure if they have any symptom, they stay home as long as they are healthy and they follow the CDC guidelines, precautions, wear the mask, wear the gloves, change gloves between each patient, wash hand, all these things. We have no problem with that. So basically, in some cases, we were allowing not the entire class. Then we says one person comes for 1 week, next we have rotations. So you don't have a big crowd in the clinic.
Thank you so much for sharing that. We never closed for 1 day. And we've actually been very, very busy all this last year. Classes are full. And it's just that we are still adapting to current circumstances and different interpretations. Like, you know, like you say CDC or what, I'm an expert in CDC protocols, NIH and so on, but they change every week. So, you know, it's not enough just to say, follow this, because those change. Of course, we're in Florida, and we have different state guidelines from virtually every other state in the country, you know. But thank you so much for sharing that. And I'm very happy to hear your opinions for all of you. And it's an honor to be with you guys today. I really appreciate it.
Thank you, Dr. James. And it's good because people are incorporating various modalities, like everybody is trying to incorporate in principles like that. But basic foundation is very, very important. What type of practice you are doing, how you are practicing, how you are communication is also important. Here, 50% of the disease will be cured by the way of talking, the way of communication, the way of care. And in addition to that, Dr. Somesh was mentioning that he is incorporating Vedic, pure way of Ayurveda and Ayurvedic chantings and everything like that. There are a lot of things there. Yes, so there's definitely having some influence on the, definitely is there. And now, like recently somebody is practicing I am practicing functional Ayurveda. So we don't have a dysfunctional Ayurveda. And somebody says that I'm a functional medicine I'm practicing. So that means other medicine is dysfunctional. The allopathic hospitals and whatever the Harvard, they are teaching all dysfunctional. What is this functional medicine? Functional medicine means, that means what allopathy doctors, what they are prescribing, that's not like an OTC products are not prescribing. That means we are incorporating vitamins and minerals and all these things. That is called a functional medicine. So now one medical doctor said that I am Shekhar, I am practicing functional Ayurveda. I said that we don't have two varieties of Ayurveda called functional Ayurveda, dysfunctional Ayurveda, Kerala Ayurveda, Punjab Ayurveda, Tamil Nadu Ayurveda, Haryana Ayurveda, Chinese Ayurveda. We don't have this type of bifurcations are there. So this is the thing, we need to come up with the proper way like that. Ayurveda is Ayurveda. Ayurveda. Ayu means life. Veda means knowledge. Knowledge of life. We are talking about the knowledge of life. Whether it is a Kerala Ayurveda, Panchakarma Ayurveda, Tamil Ayurveda, there is no separate Ayurveda like that. There is no Kerala Ayurveda separate Ayurveda. It's a branded name. Okay. Like Sommes Ayurveda. Tomorrow he will call Sommes Ayurveda and Vinamra Ayurveda, James Ayurveda, Christian Ayurveda. Now recently, white American Ayurveda. What is that? What is it? Means white American people only they practice Ayurveda? Black American Ayurveda? No, we don't have that type of things. Why we need to bifurcate these things? Ayurveda is one science, and recently one organization came, they said that we are practicing authentic Ayurveda. What is authentic Ayurveda? That means pagadi bandh ke ghumna hai. So this is the thing we need to think about that. We don't want to give the wrong message to the people. We don't want to culprit for the wrong message to the people. This is the thing is very important that this is already public is confused. We are trying to confuse more. So that is the biggest problem is coming that. So like a lot of people said that Harvard Medical School is there. Harvard Medicine, Stanford Medicine, medicine is medicine. But when they are coming to this thing, which school they studied, that is a different story. But the thing is, we don't give the medicine part like that. They don't bifurcate like that. That way, all the medical school doctors, MDs who are there, they mix together, they come together. Various schools they study, medical schools they study. They are all board certified. They are all practicing in their own practice like that. They are doing like that. No, in my anesthesia practice, only Harvard trained only can do it anesthesia. No, it's not like that. Harvard anesthetist is different from the Stanford anesthetist is different. No, both are same. So that is the thing. A lot of people they ask that, are you practicing Kerala Ayurveda? No, I am practicing Punjab Ayurveda. New word, Punjab Ayurveda.
Doctor, I have a question.
This is the thing is that very important that we have to not to separate it like that. We have to teach one science that is called Ayurveda. Yes, Pradeep.
Doctor, I just want to ask the people who are licensed massage therapists, they already have studied anatomy and physiology and all those things. What kind of a courses would you recommend for them? Either they should go for the counselor course or the consultation course.
That's the thing, because as massage therapist, they go for the anatomy, physiology, surface anatomy. They don't study too deep knowledge about the thing. 120 hours of surface anatomy they study.
Mm-hmm.
And always I recommend them to go for a basic level of like a nurses, they go to the full training program, anatomy, physiology. That is the basic information is required. That means additionally, you can take any online courses, you can take it, anatomy, physiology. If you get a chance to go and see the cadavers and everything, that way you know more. So we BAMS people, they study 2000 hours of anatomy, physiology.
Mm-hmm.
So first of all, you need to have a strong foundation of anatomy, physiology. In addition to that, Ayurvedic counselor is important. First thing is Ayurvedic counselor. First practitioner and counselor. First you need to incorporate your practice first and then practice on somebody. And then liability comes. You are the responsible for your own liability. None of the organizations, none of the persons are not going to the responsibility. You are the one sole responsible for your own liabilities, your own karma. That is called karma theory comes here. Your own karma, you have to take it. So ideally, it's recommended that Ayurvedic health counselor. If you call yourself an Ayurvedic doctor, then people will ask you that what is your credentials and background and everything they ask you. So best thing is the Ayurvedic counselor. Is the Ayurvedic health counselor is the best way to go and able to see a lot of clients and able to perform like that. Being you are a massage therapist, I wanted you to focus on that area, giving the massages and Panchakarma therapies, basic Panchakarma training and Marma therapy incorporating those things areas are very good. And if you're able to focus on the food and nutrition, that is also good for the help for the people that to incorporate food is a medicine, then you can talk about the food health like that. Good. So a lot of people are asking that whether Ayurveda is recognized in America. No, they're always talking about that. Now, after listening to all the story, Ramayana, who is Rama, who is Sita? What is the relationship between Rama and Sita? So this is the question they are asking. It's not licensed. It's self-regulated. It is in a way of incorporating Ayurveda into your other practices like that. Any other questions?
So one more question about the clinical hours. If you are not able to...
We'll talk about that separately because that is the thing. We have not come up with that idea and everything. What we do, Pradeep, your questions are beyond that time is now 4:40.
No problem. No
Yeah.
problem.
What we do, we'll take the clinical aspect, scope of practice. This is the webinar we are talking about scope of practice.
Okay.
Thank you very much, all of you, for joining. And this recording will be available on the website, posted on the website, and you can listen to these lectures and everything, listen to this webinars and everything. Thank you very much for Dr. Sommes Kaushik, even though he is so busy, Sunday, he's so busy and busy practitioner and 40 years of experience in the field of Ayurveda, and he's a real devotional to the Ayurveda. That is the thing. It's very honestly, he's promoting the Ayurveda and these things and incorporating the Vedic sciences and everything. And very good practice clinician. He's a good clinician. That's the thing. Future will have a clinical training program will be there. Only clinical training program means they have to qualify certain types of criteria to become a clinical practice. Then only, Dr. Shekhar, can you teach me again Vata, Pitta, Kapha in the clinical practice? That means they are disqualified. So, like when you go to the master's program, then again you ask me that where is the locations of Vata, Pitta, Kapha? If you ask them that, they will throw you out. So same way, you need to go for the higher levels of training means clinical training is important. Dr. Somesh and myself, we are thinking about that to putting it together nice clinical program for the Ayurvedic practitioners and BAMS doctors. We will work on that and train them for the clinical training. Maybe some telemedicine like that from India, also some doctors who can talk about that, this training program like that. Again, organizations will not give the liability for you. Organization can give only liability setup like that. It is not liable. This is all education purpose. Organization not taking anything like that. And there is no existing licensing procedures are not there in America for the Ayurveda practice. Whatever you are practicing. Like yoga teacher. Yoga is not licensed. Reiki is not here licensed. Energy medicine is not higher licensed. Similar way, but you have to have other training programs to have incorporate the principles. But again, the one principle you have to remember, do no harm. This is a very important thing. You have to by heart it every time. Do no harm principle, and no feeling of shameful to say to some other doctors to refer the patient to other people. No problem. No problem. No shy. If you don't know, honestly tell them that. Tell the patient to go to the other doctor who is well qualified, well trained. Those persons will take care about that. And that is the only advice we can give it to you. And thank you very much. And this all the speakers who has talked about that, this is not their personal reviews they are not giving. This is the general views they have given to you. AAPNA directors, associates, and all the board of directors, none of the people are liable for this lecture. This is only education purpose only. We are not liable for any talk what we did it here, and we are educating the people to know, open your eyes. Your eyes are closed. We are trying to open your eyes You judge yourself, you take this knowledge as properly and work on that. Thank you very much, one and all, for taking wonderful time on Sunday.
Thank you.
Thank you.
Thank you.
Namaste to all.